job here is quite simple. It's just to welcome you to this event this morning, and just to give you a brief introduction of AFIDEP. Caro, I believe there's a couple of slides on this, yeah? Or is it? Yeah. But really, just to acknowledge as I get started, the Kenya Editors Guild, the leadership of the Guild and the Secretariat for this partnership with AFIDEP, and to thank all of you who have really spared your time to come this morning and be part of this important meeting where we're trying to really introduce you to this program on transformative health technologies, and at the same time trying to really get you to ask questions or give you ideas on how this platform that we've formed to give a more sort of a stronger voice to African experts, African development experts, the media, and so on, in deliberating on the technologies that are, you know, as you would agree with me, flooding the continent a lot of times without input of a lot of experts on the continent in terms of the technologies themselves, the impacts, and so on. So the whole reason why we have this this platform is really to make sure that we don't just see these things blindly, and in some cases people are opposing them. It's really to provide a platform that will allow us as African experts to look at them, to look at the evidence, to look at the relevance of these technologies to the continent, and to the extent that these technologies are safe and they can be effective, then that we should play a proactive role in promoting their widespread use across the continent. So I don't know, Rose, whether this slide is coming. Where is Carol? Oh, okay. So the African Institute for Development Policy, we are a research and policy institute. We were set up in 2010. Our main aim was really to bridge the gaps between research, policy, and practice. Really coming from the background that there's so much research that is being done out there by researchers, whether it's in universities, in research organizations, many people are doing master's degrees, PhDs, writing all these theses and so on. And when you ask the question, how much of this research is really reaching the desks of decision makers, policy makers, to inform decisions that they make on whether it's setting priorities, whether it's how much money to put in various development sectors, or even various development interventions, which interventions should we use to give the best value for money, and so on, you find out that the answer is that the research is, the use of research for decision making is not as optimal. There are all sorts of reasons why that is the case. The research may not be properly packaged for use by decision makers. Sometimes a lot of scientists, we publish our work in scientific journals. The language we use to write up that, to get published in those journals, is usually very technical, that policymakers may not easily comprehend, or they may not even have time to look at the fragmented evidence that is published all over the place. So there are all those things, and also there are issues to do with capacities to access and use the evidence among decision makers themselves. And on the part of researchers, there are also capacity issues on how researchers can more effectively engage with decision makers and make sure that the evidence that they are producing is well understood. So our institute was set up to bridge these gaps, to address these bottlenecks, to bridge the gap between research, policy, and practice, to promote use of research in decision making. And we do that through two main strategies. First, we build capacity for evidence use in government itself. So over the last 10 years that we've been in existence, we've actually worked in 25 African countries. We are a Pan-African organization that works across Africa. So we've worked in 25 African countries, and we've developed curriculum for building capacity for evidence use in government. So that's a lot of our work. We've worked with parliaments, we've worked with the Kenyan parliament, helped set up the parliamentary caucus for evidence use in the Kenyan parliament, where we really wanted to make sure that, yeah, it's a political arena, but at the end of the day, it's important that the decisions, the deliberations that are happening there should be informed by evidence. So we had some MPs who were ready to challenge others in parliament and say, how do we strengthen capacity for evidence use, not only among MPs, but more critically, even strengthening the capacity of the parliamentary staff on how they can support parliamentary committees and MPs on use of evidence in decision making. So I don't know where we are, Caro, but maybe if you just go to the next one. I've talked about most of that. I'm going to the second. Yeah, so I talked about our vision really is to see Africa where evidence is used consistently. We know that evidence is used, but the whole point is it should always be used. Whenever a decision maker is making a decision, whether it's a head teacher in Meru somewhere, whether it's somebody who is heading a clinic in Homa Bay, or it's you are the county health management head there, or you are the minister, or whenever you are making decisions on what to do, on what priority to set, where should you put the money, which intervention should we use, how do we improve these services, that people should be paying attention to evidence. So we are registered in Kenya and Malawi. Our head office is here in Kenya. We have non-profit status in the USA as well. We have a board of 11 experts. We have a multidisciplinary team, about 30 staff now, about 13 PhDs and 17 master's degrees. Next one. So I was talking about our areas. I talked about the capacity building work that we do. So we build capacity for evidence use in government, but also we work a lot with researchers in building the capacity of researchers on how they can more proactively and more effectively engage with policymakers. So that's the capacity development. But the other part is where we actually generate, synthesize, and translate evidence in those 5 main areas: population dynamics and the demographic dividend. How does Africa optimize the value of its youthful population? We've done a lot of work on that continent-wide. In many of the 25 countries where we've worked, it was on that topic. In 2017, we helped get the African Union designate harnessing the demographic dividend through investments youth as the top development agenda for the continent. We work in health and well-being, transformative education and skills development, environment and climate change, governance and accountability. Those are the 5 areas. And this is our overarching theory of change. So what we do: capacity strengthening, evidence generation, building capacities. We also do a lot of work on budget tracking, just to make sure that even when decisions are made to say, okay, this is a priority and money is put there, often we see that money doesn't move. Sometimes governments, even when they allocate money, if there are people not tracking the use of that money, we tend to pay a lot of attention to the budget day, when the Minister of Finance comes to read the budget. All the money has gone here, but not as much attention on trying to say, how is that money used? Which are the departments that are not actually burning out the money to make sure that they are delivering the services? So we build the capacity. There are those research outputs. The main things that we are trying really to influence is to make sure that there's greater, stronger political commitment and enabling policy environment for Africa to address its pervasive development problems. In many cases, we know politicians, they really have a critical role to play, but are they really using it to make sure that we drive the development agenda in Africa? The other part is really to improve budget allocation and priority setting. Are we setting the right priority? Effective programs. And with that, we expect that service delivery will be improved, and then we'll achieve the a better well-being of all Africans. So that's the institute. This project sits mainly in our health and well-being as well as governance thematic areas. And I'll not take much more time, Mr. Moderator, and I'll get back to you. But again, it's to thank you, the partnership with the Kenya Editors Guild. We really look forward to working with you. There are a lot of other areas where we work, and we believe that the media has a very, very critical role to play in not only highlighting what are the critical issues, but also in making sure that if the reporting is really being done informed by evidence, and that journalists can easily access evidence, that the power of the media will be really strongly enhanced if there's really a strong evidence culture in the media as well, because you really, as the fourth state, you really play a very, very big role. I might have evidence, I might have an issue. If it's not on the headline of a newspaper or somewhere, politicians may not pay attention to it. So I think we can really have a very, very strong synergistic partnership in terms of really achieving the goals that the media has, but also research institute like AFIDEP, that we can really make sure that evidence is having the impact that it should actually have. So thanks a lot, and I thank the Guild as well as our partners who are here speaking, the professors and everybody who is on the list, and I look forward to the discussion. Thank you.
Thank you so much, Daktari. Our next speaker is from the Editors Guild. I can't see Zubeida, who is a representative from Editors Guild. Pardon? Ruth Nesoba, is she? Okay, I'm told she's running late. Can I invite Dr. Rose Oronje, please? Rose. As she walks in here, Ruth is the Director of Public Policy and Knowledge Transformation and Head of Nairobi Office, AFIDEP. Karibu, Rose.
Thank you so much, Ben, and thank you everybody for sparing time to join us this morning. I actually don't want to speak from here because I like to control my slides rather than saying next, so I would rather speak from here. I think you can all still hear me even if I don't speak from the podium. So I will be introducing some of the work on the platform for dialogue and action on emerging technologies, just setting the stage so that we get into more targeted discussions on some of these technologies. So I think the big point for the conversation today, I hope I'm not blocking anybody, I think I have another screen there and here. But the big point for the conversation here today is really not just looking at these emerging technologies, but thinking about, can Africa harness their potential, to address the persisting health issues, but also new health issues. So we're really keen here to talk about these technologies, but importantly, look at what does Africa need to do to really benefit from the potential of these technologies, if they're well developed and if they're well tested and if they're proven to be safe and efficacious. Health remains a major challenge on the continent, and we can't say that enough. I think we all struggle with health issues in our families, in our communities. And on this slide, we've just put up some of the major causes of death on the continent. And as you look at some of the 100,000 people, there are rates that are very high. It would have been actually better if these rates were being compared with the rates of other parts of the world, just to see that health issues remain really big in Africa. We look at neonatal conditions still killing a lot of babies. We are looking at respiratory infections, diarrheal infections, HIV/AIDS. All these are diseases that are still claiming a lot of lives on the continent. And yet for many of them, we know that they can actually be prevented, that there are technologies out there that can actually reduce some of these diseases. Another important point is the fact that because of low investments in health, our health systems have remained very, very weak. We know the infrastructure is weak. Facilities sometimes are there in the communities, but they don't have medicines, they don't have healthcare providers, which has just meant that a lot of people on the continent, not just in Kenya, but on the continent, are really struggling to access quality healthcare. That has remained a pipe dream. And you know that African governments, including the Kenya government, talks about universal health coverage, ensuring that everybody has access to quality. But that remains a dream. We still have a really long way to go to get to a point where we can say, when I fall sick in a little community somewhere, I can get into the next facility and get access to the healthcare that I need. And so for many, many people on the continent, health and access to quality healthcare remains a challenge. We know that COVID-19 has complicated or compounded the whole problem. I have some data on this slide that just shows, this is research done last year, showing how COVID-19 just affected access to services. And some of these are really key services. We know that the impact of COVID-19 is actually going to be realized in the years to come. You're going to see the data coming out in terms of impact. But just access to services, health facilities noted a lot of reductions in access to services. Testing for HIV fell. Access to PMTCT services went down. TB referrals also fell by a huge margin. And the impact of all this limited access to services that has been compounded by the pandemic is going to be seen in the years to come. But importantly and political, we know that Africa will continue to bear the brunt of access to the vaccines. When you look at that diagram, that very nice chart there, which we picked that specific snapshot on October 2nd, Africa is the one there that the vaccines are not available. We are bearing the brand of iniquity of these vaccines. And yet we know that even for some of these vaccines, some of them were actually tested in African communities, right? Some of them were tested here. But when it comes to access, we are not accessing. And so for us, what we are saying with this platform is that what COVID-19 is showing us is that Africa needs to really take charge. We need to take charge. We can't continue letting people develop technology. Some of them come and develop them here without really engaging key stakeholders, without engaging our communities, without engaging our governments, in a way that when these technologies are proven to work and they're safe, we actually need to have access to them, right? And what we've seen with the COVID-19 vaccine is that, yes, they can be tested here, but when they're proven safe and they're being used, we don't have access to them. So there's really no better time for us to be sitting here and talking about emerging health technologies than now, particularly with the experience we've gone through with the COVID vaccine. We need to, as Africans, have the spaces where we can understand some of these technologies being developed on the continent for health issues, but importantly, ensure that these technologies are speaking to our needs, they're speaking to our concerns, they're speaking to our context, but importantly, they're also owned. There's ownership as well by our governments and by ourselves, so that people don't come here, test technologies, and then once these work, they're not really benefiting Africans. And when you talk about these emerging technologies, we are calling them emerging transformative because some of them don't lend themselves to the conventional, technologies that we know about. And some of these technologies have to do with gene drives, like there's research going on to test gene drive mosquitoes for the elimination of malaria on the continent. There's vaccines being developed, mRNA vaccines, and we've seen some of the COVID vaccines actually drawing on that technology for that. There's artificial intelligence, there's use of drones in healthcare, there's a lot of research going on synthetic biology and how it can be a solution to some of the issues. Importantly, the African Union has actually prioritized a number of health technologies. And what the Union has said is that there's various technologies being developed which can transform health in a big way on the continent. And some of these are technologies that we've listed here based on the AU's priorities. There's a group of technologies they call omic technologies, and genomics fall there with a range of other technologies. There's the issue of e-health. Again, e-health solutions being used in different communities to, again, just enhance access to health. There's the issue of artificial intelligence. There's the use of drones. There's geospatial modeling, and there's additive manufacturing. What the AU is trying to do is to ensure that researchers are doing research on these technologies. We have the right regulatory frameworks to guide their development, but also governments are also paying attention to them in terms of understanding what can these technologies do, how can they change the health narrative on the continent. But importantly, How can this be developed in a space that is involving a lot more communities that are going to be the ones benefiting from these technologies if they are actually proven to be effective? We've done a recent landscape study that has shown that there are a lot of ongoing efforts developing different types of new technologies to tackle health issues, and some of them are listed on this slide. But the big point there is that information on this is actually not readily available. And so you find the various research groups around the continent in different countries doing some work, testing different technologies, or even some just developing them because they haven't reached the point where they're being tested yet, or some of them are being piloted. But what you find is that beyond the research groups, right, doing this work, you don't find much engagement with other stakeholders, the people who are going to benefit from these technologies. You don't find much engagement with government agencies that are even needed to maybe even regulate in legal ways for some of these technologies. And so part of what we hope this platform would do is to expand those conversations beyond the research groups, so that the research groups, yes, they're testing, they're developing various technologies, but they're also involving key communities. They're also involving key government agencies. They're involving parliamentarians, people who allocate resources. They're involving the private sector, for instance. We actually found the private sector being very silent in these efforts. And yet, if some of these technologies actually are proven to work and effective, we would need the private sector to be at a point where they can be manufactured locally, so that these are accessible to our communities. And so information is not available, and a lot of people outside the research groups do not know about these technologies. We zeroed in quite a bit on malaria, again, knowing very well that malaria remains a major killer globally, but most of those deaths, 94 of those deaths are happening in Africa. And so malaria is really an African problem. And we looked at some of the work that is going on around the continent to improve the control, but also move towards elimination of malaria, because malaria has been around for a while. And it's persisting because the current tools being used are obviously either failing to address the problem or not able to address the problem. And so we mapped quite a lot of research going on in different parts of Africa on various tools. Some of these tools are the gene-derived mosquitoes, which we'll talk about a bit today. But we also have ivermectin drug, which is being tested in some of parts of the continent. We have, and Prof. Mbogo is going to talk about this. I won't go into a lot of details, really, because he's going to talk a bit more into some of these tools. There are various malaria vaccines being trialed as well. There's research as well on sterile insect technology being trialed in South Africa. And of course, there is an old technology that has been there, but which hasn't been really rolled out, the use of biocontrol or larvicide control for controlling mosquito populations. And so what we are flagging is that this work is there, but it needs to move beyond the research communities that are conducting this. We note, however, that there are a lot of issues that are undermining the development or testing of these technologies. And this is part of what this platform hopes to speak to. One of them is really limited involvement or participation of Africans in technology development. I think I've said that. The second one is limited knowledge among key stakeholders on some of these technologies. So people will tell you, I've heard about some work being done on this, but I don't know much about it. And yet these are the people we're hoping they will benefit from some of this work. For some of the technologies, there's actually opposition to them, particularly technologies that are seen to challenge nature, for instance. And gene drives, which we're going to talk about today, is one of those technologies that there's a lot of opposition on the technology, even though the work is only starting, But there's already a lot of funded and very well organized opposition to this work being conducted on the continent to explore if this is a tool that could contribute to malaria control. Importantly, the final bullet here is about the limited priority and investments in these technologies by our own governments. Of all the technologies we've mapped and all the work going on, the funding is coming from abroad. And we know that has implications, right? Our own governments are not really putting in much money for the development of these technologies. And it's not really just putting in the money, but even when you don't have the money to put in, I think there are better partnerships that our governments can get into with some of these funders to ensure that these technologies, yes, they're being funded by somebody else, but the technologies that are owned, by African governments, that if this, when they're proven to work, there's a lot more ownership and production of this on the continent for them to benefit the continent. And so the last bullet here is really important, but we also know that It has to do with political commitment. It has to do with political will. And the media has a big role to play, because if the African Union prioritizes so many technologies and African governments are not investing in their development, then who is investing in their development? So we really need to have that conversation as well in terms of saying, yes, these are key technologies. They could change lives on the continent. Other people are investing in them. Can our governments also put in, if it's 5%, so that there's more ownership and there's a more balanced conversation around this work? And so I'll move on to just say very briefly about the platform for dialogue and action on health technologies in Africa, which is a very recent initiative by African Institute for Development Policy. And we're hoping that it's an initiative that is going to be owned by a lot more partners, that it's not just an AFIDE project, but it's a space where, even as media, see as a space where you can come and engage with the various research teams developing these technologies. You can come and engage within this platform with governments to understand what investments they're putting, what regulatory frameworks they're putting in place to guide the development of these technologies. And so it's a platform that we are currently engaging a lot of actors on the continent so that they can come on board and own some of the work of this platform. The main purpose of this, it is an African-driven platform, of course, to facilitate informed, objective, balanced discussions around development and use of transformative technologies. And the purpose is really to expand the space so that as Africans, we can more meaningfully engage around this work that is being done on the continent, to understand what it is, but importantly, to understand its potential, and also inform this development with our own needs, our own concerns, so that these technologies can speak to our context and to our needs. We're hoping the platform will work at national and regional levels, and so work in a few countries on the continent, but also work at regional level, engaging policymakers and researchers, academics, as well as ethicists, people who look at the ethics of research, engaging civil society, engaging media, engaging private sector, as well as engaging communities. In terms of some of the expected outcomes, the main primary outcome is improved policy and regulatory frameworks on the development and use of these technologies for tackling health challenges on the continent. And to feed into that primary outcome, we are looking at three intermediate outcomes. One of them is increased use of evidence on these technologies, because we also don't just want to have conversations around these technologies, but we want to talk about the evidence on these technologies. What do we know about them? What is coming out of the research about these technologies? And especially for technologies where there is notable amounts of opposition, we hope this platform can provide a space where this opposition and the concerns and the fears can be discussed as well, so that we have those discussed, as well as the evidence that is on that technology discussed to address some of the fears and concerns. Second intermediate outcome is strengthened champions. So we are looking at a wide range of experts, be it among researchers, among media, development experts, who can understand and talk about these technologies beyond, the small research teams doing this research, just to expand awareness, expand knowledge, and ensure that a lot more actors are involved and understand the work that is going on in these technologies. The third outcome is strengthened capacity of African institutions in conducting this kind of dialogues and engagement around these technologies, so that as we get into the future and technology is taking charge of our lives, we are more engaged as Africans and involved in the conversations and shaping how those conversations can meaningfully improve health on the continent. In this slide, we just show how the platform is going to work. So there is some work at the continental level, working with the African Union and various research groups and CSOs and media networks at that level. We're also working at the sub-regional level, so looking at the East African community, for instance, looking at the West African community, looking at SADC, but importantly, looking at the key actors within those communities and the key health technologies being developed in this region, so that we're engaging different regions on the technologies that are being developed to tackle various health issues in those areas. And then we have some work at country level, a lot of focus on Uganda and Burkina Faso. And that is mainly because there is some level of priority we are giving to the work on gene drives for malaria control. And this research is going on in those two countries. And so the platform will be facilitating some dialogues around those technologies in those countries. And of course, Kenya being a a regional hub as far as many development actors are concerned, we also want to sustain conversations in Nairobi and key actors in the country around these technologies. On the far right, we have some of the activities we are going to be implementing, particularly sustained dialogues on these issues, reviews and analysis of evidence on these technologies, and of course, sharing those evidence. Engagements with champions, with civil society, with media, and as well engaging through virtual platforms. In terms of our priorities, we are looking at facilitating conversations around a range of priority technologies. And so we have prioritized the gene drives for mosquito, for malaria control and elimination, but we are also looking at other key technologies, particularly technologies around malaria elimination. Yeah, and then technologies also around e-health. There's a lot of innovation going on around how e-solutions could really expand access to health services. We are also, of course, looking at the major health issues and thinking about what are those technologies around these issues. And so we want to increase knowledge and understanding. We want to, of course, support the power of the media in expanding and informing publics. We also want to share as much as possible critical analysis and reviews on these technologies, but also facilitate experts to talk about these technologies. I want to have critical discussions, particularly around benefits, around risks, around fears, around concerns, around this technology, so that the developers of these technologies can take this into consideration. We also want to nurture and support champions as well as expand investments in this and expand involvement of the private sector. Just something little on gene drives as we lead into the presentation by the experts on this area. So the African Union has actually made a commitment to facilitate and regulate the development of the gene drives technology for malaria control on the continent. And they've done that mainly because of the huge malaria burden that the continent continues to bear. And so in 2017, AU has made this commitment, and it has gone further to make very specific or call for very specific recommendations on this. One of them is establishment of a network of African experts who can ensure that we are self-regulating, even as we do research on these gene drives. The need for African countries to develop the legal framework needed to guide the work that will go on gene drives in the coming years, and the need for experts to actually model the risks so that we also understand the risks around these technologies. And of course, the need for more proactive involvement of policymakers as well as the private sector. And so we are prioritizing this technology mainly because of the malaria burden, but also because there's a lot of work going on the continent, and also the African Union has really made some commitments on this. Some of the initial work we've done just to understand who are the stakeholders involved in the ongoing research that is going to explore if gene drives could eliminate malaria on the continent. So the Africa Union Development Agency is leading a lot of efforts to support countries to develop regulatory frameworks on that. There are various research groups, the external funders who are funding that work. A few government agencies are involved in that, and communities where this work is being done are actually also involved to understand how this technology works. There is quite a lot of opposition from some CSOs around this work being conducted on the continent. We noted, however, that key stakeholders here are not involved at all in some of these conversations. So the media is not there. Key government agencies, particularly ministries of health, malaria programs, not very, very well, involved in the work. Private sector, but of course, as well as members of the public. There are some policy and regulatory issues relating to gene drives, and this will be talked in a bit more detail by one of our presenters today. But I think the big thing is the lack of precedent on this work, which has meant that there are no regulatory guidelines to shape how this work is being done on the continent. There's also the issue of how to govern the technology, given that there are implications for mosquitoes going across the border. And I think, Prof, you'll be talking a bit about that. What does that mean? There's need for decision-making to balance technical benefits and risks, as well as community concerns. And of course, the need for capacity. The capacity on the continent for this technology is very limited. So how do we even address that even as we continue exploring the research on this area? I think that's my last slide, or what has happened. Not sure what I've done, Caro. Is that my last slide? Okay, so this is my last slide, I think. Sorry, I think things changed. Some of the important things we're hoping that the platform will speak to is intellectual property rights and the African Academy, particularly understanding that this work is mostly funded by external funders. And so what does that mean for intellectual property rights? What does that mean for the African Academy? The issues to do with equity, power, and justice in governance of emerging technologies. So again, going back to who's funding the work. If this technology works, how is Africa or Africans involved in its governance, its access? And I think we can see that playing out quite a bit with the COVID vaccine. But we need to learn lessons from that so that even other technologies being developed here but funded by external actors, we are addressing the governance issues even as the work is going on. There's the issue of transparency and public engagement, very, very important, because we are the ones who are going to benefit from these technologies. And so we need to be involved a lot more and understand how they're working. And then, of course, the issue of low priority and investments in research remains a big area where we need to constantly engage our governments to start putting in the money so that we can also own and be part of these discussions, ongoing discourse on technologies. So this is just thinking of how can the media be involved in the activities of this platform. We actually believe media has a central place or a central role in the work of this platform, particularly because of the media's role in informing the publics about the potential of these technologies, about the ongoing research on these technologies, but also the media has a role to provide a space or a platform for dialogues, particularly for technology where there's a lot of opposition, space for people to talk about these concerns, these fears, and just understand, as well as engaging the experts to respond to some of the questions people have about some of these technologies. But also the media has a role in putting emerging technologies on the political agenda. We've talked about our governments not investing in them at all, which means these are not very important things to them. The media has a role in reminding our governments that we need to be putting in the money, that if somebody else is putting in 50%, in this research, we also put in 50% so that there's more ownership and we have a voice as Africans on the table where this research is being done. As a platform, we have some activities that we are hoping we will be partnering with media. Some of them are sustained meetings like this one. We hope this won't be the last meeting. We want to have sustained meetings around these different technologies just to create understanding, to create opportunity to connect with the experts who are developing these technologies, but also enhance interest and understanding. We have some range of trainings for reporters or journalists on specific health technologies, just again to increase knowledge, because you can only cover or talk about these technologies if you actually understand them. There is a plan to have some awards of excellence, again, to motivate interest in this. And of course, sustained partnerships, starting with us being here with the Editors Guild. We hope that we'll have sustained partnerships with different media networks to sustain conversations on these technologies. Thank you very much.
Thank you, Rose. Talking about sustained partnership, I think it's the right time now to invite Rose Nesoba, representing the Kenya Editors Guild. Rose, karibu. Ruth Nesoba, sorry. Karibu.
Good morning, ladies and gentlemen, all protocols observed. I'm standing here today on behalf of the Kenya Editors Guild and speaking on behalf of the President who couldn't make it, but sends his greetings to you today. Picking on from what the previous presenter, Rose, has talked about, is importantly for us as we sit here today to start that discussion, the deliberations on interventions that we as media can come in with in terms of looking at the whole subject of malaria. As we have heard, malaria is a killer disease, and all of us know that in sub-Saharan Africa. Here in Kenya, there are an estimated 3.5 million new clinical cases and 10,700 deaths every year. And this is according to the Africa CDC. And those living in Western Kenya have a special high risk of malaria. Looking at places like Coast, Nyanza, Western Province, transmission cases are ever on the increase. But how much of this is making headlines in the country? How much of this is getting into our media spaces and platforms? Very little, if I can see. So as much attention is being paid to new pandemics, the Ebolas, the COVID-19s and all that, we should not forget diseases like malaria that are causing a very huge impact on the economy and a very huge burden on the health sector. So we've seen already that a wide range of preventative measures that are tailored to tackle the disease here in the country have been implemented and have resulted in major progress against malaria. But with declining resources, with attention shifting elsewhere, it is upon us to make sure that we are asking those key questions of the stakeholders and the policymakers in the country, ensuring that they still stay on the course to ensure that all efforts can be put into place to eliminate or to prevent malaria. So it comes to us, how much reporting is filtering into our pages on malaria? And what has been the progress so far? Are we telling that story? And if we are we telling it in the right way to that person we commonly refer to as Mama Mboga? The numbers that the doctors and the experts are coming up with, how much effort are we putting into crunching those numbers and making them resonate with the audiences that we are speaking to? Are we putting faces behind the stories that we are talking about? It is very well to say that 3.5 million people are dying of malaria every day or every year across the world. But do we go further to start telling the story of that one little girl who was denied an opportunity to see her 5th birthday if there was prevention for her disease? So these are the things that we should be talking about. And I would like to say that through the media, platforms to interact with the health experts and learn how to limit the exposure of malaria will be made available. But at the same time, we have a challenge as media sometimes to access these experts. Many calls have been made sometimes, of can I get somebody to come on our program to speak about malaria? And as we know, scientists and experts are so busy in the lab, sometimes they even forget that they have to tell us what they are doing, and access to them becomes very difficult. So even when we start talking about the networks and the linkages that we want to create, please also ensure that we have looked at the bit of making experts available for interviews on our media networks. The other thing that we need to really ensure is, as we continue to talk about getting access, this previous speaker spoke about training for journalists so that we can continue to specialize. We can continue to not just be like general reporting that you're a jack of all news or trades, to see that we are more focused and more dedicated to the stories that we are telling as media. And as we continue to do this, I'm sure that we will be able to continue having that discussion on our national platforms, in our parliamentarians, in legislation, in whatever networks or whatever places that we are working in, to ensure that we continue to play our role as media in passing the same information to the public and thus educate them on what is available. But importantly is also how we are going to be packaging this news. How do we make it resonate with the people that we are talking about? The reason sometimes malaria stories do not make big headlines or big news is in the way we are packaging them, is the way we are approaching them. Can we look at how to come up with more creative ways of content making amongst ourselves as media? And so I wouldn't want to belabor the point and use so much time, but to say thank you very much, AFIDEP, for offering us this opportunity to collaborate with you yourselves as media. Do make available all the contacts and all the resources that you have. For instance, if there is a report coming up like in 2 weeks' time on an intervention, can you give us advance notice and tell us that we have been working on this and we will be releasing it on this and this day, so that together we can join forces and try to make that trend or trail that information ahead of when you're going to launch it, so that we can keep, like trying to create some momentum and some traction towards this kind of stories. The other thing that we can also try to do is to ensure that labs and the white coats that experts sometimes put on can be very intimidating. But how can we make it friendly? How about one day you just take us through a walk through some of the facilities or the institutions where this technology advances are being made or created, so that we can walk and talk our audience or our listeners or our readers through the behind the scenes stories or activities that are going on into the efforts to fight or to eliminate malaria in the country. So it's just food for thought, but I'm sure because we have already created the networks and the contacts here, we will continue discussing this. Thank you so much, Asante.
Thank you, Ruth. I guess we're at that stage where need to invite Dr. Mercy Koreishi in. I haven't seen her. So before we move to the next presentation, if at all there are any questions to the presentations made earlier on, please, can we take maybe 5 minutes of that? Is there any questions for now? Comments, responses?
Thank you, Ben. I saw that Kenya is included in the pilot projects, and I was wondering if you could get a little bit more information on that. How far the pilots have gone, what's happening on the ground right now? For the question?
I guess you got the question from Helen Rose. Helen, can you repeat, please?
I said we have noticed that Kenya was included in the pilot projects in Africa on the malaria projects. So we would like a little more information on that. How far have the pilots gone? What is happening currently?
Okay, I can respond to that. So Kenya is one of the focus countries for the platform's conversations, and not necessarily for the research that is being explored on gene drives. But there is a lot more research going on in Kenya on various tools for malaria control. And actually, maybe we should hold on to this question until Professor Mbogo presents. And then, because he will speak a bit more on the tools being developed, and some of those are actually in Kenya. And then we can come back to it. So he'll speak to that. And even Professor Kabana will also speak about the ongoing research on gene drives. Yes, it's not planned for Kenya, but he has some insights there on how that connects to Kenya. So we can come back to that question. Thank you.
Thank you, Rose. It's at this particular moment we move to the next presentation by Professor Charles Mbogo. Sorry. Just a brief introduction, Professor Charles Mbogo. Professor Charles is a public health entomologist with over 30 years experience in the conduct of entomological studies in Kenya, Ethiopia, and Eritrea. He's the chief research scientist of the Kenya Medical Research Institute, Center for Geographic Medicine Research, and the Kemley Wellcome Trust Research Program, Nairobi. He's the head of Vector Biology and Ecology Department and Vector Public Health Unit at Kemley Wellcome Trust, Nairobi. Karibu, Professor.
Okay, thank you very much. I think I'll speak from here. For the invite to discuss with you more about the new vector control tools in place and the current tools that are actually working at the moment and how far we are going depending on how malaria is actually becoming an emerging disease, because it's always been there, but we didn't need to think on how we are going to move to the next level of malaria elimination. Next slide. I would like to start explaining to you the difference between the different mosquitoes that you normally see. And sometimes I get a bit irritated when I see people referring to the mosquito that is very colorful at the bottom there as a malaria vector. That mosquito does not transmit malaria at all. Mosquito is beautiful, very well colored, and bites just during the day and especially in the afternoon. It's a mosquito that we refer to as the yellow fever mosquito. Transmits yellow fever, it transmits other apoviral diseases. The next one on the left below is a curicine mosquito. It also does transmit apoviral diseases. And so that's a different type of mosquito. But the mosquito we are going to talk about today is the above two mosquitoes. Actually, it's the same one. The first one there is one that has not fainted. It's very angry. I mean, it has not eaten at all. But the next one has already eaten to its full capacity. And as it eats, it tries to concentrate more blood and even all the parasites together and starts exuding the blood through its hind parts. That mosquito is the most efficient vector of malaria in Africa. It's only found in Africa, it's not found in other areas. So we know we have about 400,000 species of mosquitoes all over the world, but only 70 mosquitoes of the species Anopheles transmit malaria. But only 2 of these are found in Africa. The 2 which are the most efficient, the one we refer to as Anopheles gambiae and Anopheles fenestas. Those are 2. But when we go further into research, we find that the Anopheles gambiae makes about 8 other species within it, because we refer to it as sibling species or more related species. And the other one, Anopheles fenestas, has 9 sibling species within it. And you can only be able to identify that species, not only morphologically, but molecular techniques. Next slide, please. Now, what are the current proven malaria control interventions in Africa? The first 3 are the main core vector control tools that we have in Africa. And this is the bed nets, which we normally refer to as bed nets. And currently we have what we call the long-lasting insecticide nets, or LLNs. That one is actually being distributed all across Africa and Asia and other areas where malaria is actually a problem. It's a tool that prevents mosquito bites when you are asleep. And the next one is the indoor residual spraying. That is, you use insecticides to spray on the walls of the houses where people live. And then the other one is the larval source management. Larval source management is that you have really to understand exactly where the mosquitoes are breeding. And the moment you understand where the mosquitoes are breeding, then you can use larvicides, you can use biological control, and treat those breeding sites, and then you kill all the mosquitoes at that level. And then you will not get animals to go and feed. So those 3 are the main core vector control tools that are normally used. But larval source management is recommended by WHO to be used as a supplementary or complementary techniques that you can be able to use, because even if you use indoor residue spray and LLNs, you cannot completely eliminate malaria. And therefore, you need other tools. Other control measures for malaria are now on the side of tackling the humans, especially the use of malaria vaccines, which I'm not going to talk about today, the treatment of pregnant women for malaria, and treatment of young children, especially those living in seasonal transmission areas, and also case management, there where you require proper diagnosis and the treatment of malaria cases. So that has been the mainstay, but now when we brought in the main vector control tools, then it means that you have to procure those ones, you have to do more research about them, and you also have to understand the socio-behavioral change in the people. This is all very important, because if you do not understand the behavior of people, then you not understand the behavior of the mosquitoes. Allow me to remove this. So the main thing here is, imagine what normally happens when you are outside the mosquito nets. It means you are exposing yourself to mosquito bites, and therefore you are not protected. So we need techniques that can protect you when you are outside the mosquito net. When you spray houses inside, sometimes you find yourself outside, socializing out there, and you are not in a place that is sprayed. You need other techniques to help you to control mosquitoes in this area. Next slide, please. So, according to WHO report of 2020, it was found that malaria is the core increase in African region. About 94% of all malaria cases come from Africa region. The other 6% come from the other regions, maybe the Asian region and the South American region. However, in Africa, about 6 countries out of the 10 marked as high impact or high mortality areas. We have 6 countries producing about 51% of all malaria cases in Africa, which includes Nigeria producing about 27%. So these countries, which we refer to as high impact countries, are actually main countries that now WHO is focusing on, so that we can be able to reduce the malaria cases in Africa, and we can be able to see whether we can be able to do that. Kenya is not among these, because at the moment, Kenya only has about 8% on average malaria cases in Africa. And what is needed is we need to integrate all the methods that we have so that we can see how we can be able to move there. Okay, now considering that we have all the tools that we use to control malaria, yet we are not out of the woods yet. and it's the only insecticide that is actually used for treating bed nets, then you are exposing mosquitoes to a selection pressure that they now become resistant to the insecticides. And at the same time, the mosquito has also understood what you are doing, and they are quite intelligent, and they also start behaving differently. So they start behaving in such a way that they will avoid getting to those houses, and they wait for you outside there. And as they wait for you outside there, then they bite you and transmit malaria outside there. From our own research, we have found that even after using bed nets, about 16% of all transmission taking place, even within a household, comes from mosquitoes biting outdoors. And this is basically part of what we refer to as residue transmission. So other issues about technical, systematic, financial, I think it will come for another day because there are so many of those challenges. And unless we integrate all these together, then we will not be able to eliminate malaria in Africa. Next slide, please. But we have understood that mosquitoes are becoming resistant to insecticides used to control their populations. So if you look at the map on the right side of that, you see the red dots in Africa. This is a spread of insecticide resistance to pyrethroids and other insecticides. And you can see it is all across Africa, especially in sub-Saharan Africa. Why is this? Around 3 p.m. So at that time, we understood that you are all under mosquito band and you are sleeping under the nets. So you're protected. But now they have learned that they can be able to move out. So that's why we have the picture there, where we find kind of gaps, that up to 10 p.m., there's a gap between 5 p.m. or 6 p.m. to 4 p.m., for 10 p.m. At that time, you're exposed to mosquitoes. And again, there is another small gap from around 5 a.m. to 6 a.m. Malaria mosquitoes do not bite during the day unless you are in a dark place. And so that gap is what we need to tackle in order to eliminate malaria. That's where transmission also takes place. You wonder, you are using bed nets, you are using IRS, yet you are doing this. This is because we are only targeting mosquitoes that bite indoors, but we are not targeting mosquitoes that bite outdoors. In other situations, you find people working at night, like watchmen and other people. How are we protecting them? Yeah? And so all people going to work in the forest, like in Asian countries, then you find them that they are all exposed to mosquito bites and transmission. So due to this, new vector control tools are being developed. Same way. Next slide, please. Now, what are these current tools that we have? We have tools that are already approved for use by WHO and which are currently in use. I've talked about pyrethroid nets or LLNs. We have also talked about indoor residue spray, and we have also seen new tools of new nets, which we call them pyrethroid nets or PBO nets. They have a synergist that helps the mosquito that has become resistant to become susceptible again. So these nets are already now in Kenya, and they are already been distributed. They have already been distributed in 3 counties in Western Kenya, Kakamega, Bungoma, and Busia. And that, because the high resistance rate is quite high there, they are going to have that. Assuming that is a kind of an environment that you have plants, you have mosquitoes flying all over, breeding sites there, you have cows there, because mosquitoes also feed on cows. And we can also use cows as a kind of deflecting mosquito bites. And this is what we call sulfophaxis. And you can be able to help in that particular direction. So we have indoor residue sprays. Those ones I've already mentioned that are the approved tools. But we have tools in development that can be used indoors, like having attractive targeted sugar beets. I'm going to talk about that later. And also house improvements. Have you noticed, if you improve your house structure, you have fewer mosquitoes in that. And if you take into precautions that you need to build the houses in the right directions. So malaria control should also bring in engineers, architects, so that we can discuss how the house improvements can be done. So that is important that we need to think about that too. When we talk about outdoors, we are talking about larval source management. This is approved by WHO, as well as the use of space spraying. Space spraying is like you have a car moving, fogging all around. You are doing what we call space spraying. But we have tools in development, quite a number of tools in development that can be used in outdoor structures. But there are tools also that can be used from both indoors and outdoors, like gene drive technologies. We are going to talk a little bit about that. There's one we call the trap-free treated products, or let me call insecticide treated products. These are in the development stages, where now you have a chair like the one you are seated with a material that has been impregnated but put under the seat, and it will be emitting the chemicals to drive away the mosquitoes. Or you can have shoes that have an insecticide treated, and you can just be able to walk. And have you ever known exactly why mosquitoes always want to come and bite around the angle here? This is basically because of the odors that you produce, and especially for men. If you remove your shoes and even hang your socks just somewhere there, in the morning you find so many mosquitoes enjoying the odors that you have there. So when you understand about all this biting behavior of mosquitoes, then you can now be able to develop the right tools that you require in order to develop them. Next slide, please. So what are the new innovative vector control tools? I'm going to talk about only 3 main ones. First is what we call the attractive toxic sugar beets. And this is based on mosquito active to feeding on sugar. Every time the mosquito comes from the breeding sites and as an adult, it has come out. The first thing it wants to do is to feed on sugar. And the sugar provides energy for it to fly. And even when they feed on people and they have already laid their eggs and they want to fly further, they will definitely go and look for sugar. And they normally get it from the nectar from plants. And this is based on that. So the home bait thing is actually based on having a bait that you can attract those mosquitoes to that place. But then add an insecticide there that you have invited them there to the bait, which has sugar, and then kill them. So the toxic bait is something to kill them. And within a few days, they are all dead. This testing here is being done in various places. And the advantage of this is that it is very, very highly effective and can kill all mosquitoes, including the non-vector mosquitoes that transmit apovirus diseases. So we have this now going for large-scale testing in Mali, here in Kenya, in Western Kenya, as well as in Zambia. And once the results of this comes out, I think you will be in a better position because that bait is a simple thing that you can just hang in the house like a potost plate. And it has that thing. You can hang it in the house. And mosquitoes will just be coming and being attracted there. Just like the way I said that you can have your socks removed and hang them there. They will be attracting mosquitoes there. That is the kind of thing. And by the morning, you have not had any bites. They will have all been dead. That's a very good technique that you can even put these bait stations outside and they will attract mosquitoes and they will be able. That's one which is coming out very strongly and has been tested in Western Kenya and is being tested actually in Western Kenya at the moment. It has been tested in West Africa and other countries. And in Mali, that is where they started the work there. And it was found to be very, very good. Next slide, please. So the second type of tool that has a very high potential for malaria control is the use of ivermectin. For those who are veterinarians, ivermectin has always been used in the treatment of endoparasites in cows. But later on, it was used for the treatment of lymphatic filariasis, or what we refer to as elephantiasis, where now people get mass drug administration. And it was found that in areas where people are given this drug, mosquito survival rate was very low, was very low, and they are dying in numbers, and malaria cases were also going down, as well as the filarial disease coming down. So you can imagine where you are given a drug to take maybe once every 6 months, and any mosquitoes coming to you is actually, you become lethal to it. Is that not very good? Yeah, you just take a drug and they will just die. So that is a very good thing that we can use mass ivermectin treatment on humans or in cows, because if a mosquito fails to get a blood meal at the time it required, because you have slept under the net, it won't go to the cow or the other animals that are available. Because all what the mosquito wants is a blood meal. And when does it get a blood meal? To perpetuate its own progeny, because it is going to lay eggs after that. And after feeding 2 to 3 days, it comes back and starts feeding again. That's basically how transmission goes on. We have large-scale ivermectin field trials that are going on this, and we hope in the next 2 years, we will be able to get the full results about this. They are going on in the Gambia, where they are using a combination of that ivermectin and a combination of artemisinin and primaquine. And then Burkina Faso, they are also using, together with seasonal malaria chemophaxis, using the SP and mondaraquine. While in Tanzania and Mozambique, where we were actually part of Kenya, Kenya was actually part of this. But when it was reviewed, we were told that the threshold for malaria control and whatever was actually required for us to reach was actually we were below what was required. Because in those countries, malaria prevalence and malaria incidence was more than 30%. In Kenya, in the areas we had selected was less than 80%. And so they needed anything beyond 30%. So it's being done in Tanzania and Mozambique, where malaria prevalence is very high, and it's actually being given in ivermectin to humans and also to the cattle. So you have cows in the area, they are given, and then they monitor to see the number of cases of malaria coming out and whatever is happening. And in Burkina Faso and Cote d'Ivoire is also following the same thing. So these are tools that are coming in very quickly. Next slide, please. The third one, and which is of great interest, is the gene drive technologies. What does gene drive technology mean? We say that it's about control technology, making the populations incompetent to transmit malaria or reducing the prevalence of the disease. So we can reduce the vector population, or what we call the vector suppression. This is what we have here. The vector suppression here. If you introduce those mosquitoes and release them in the environment, they will mate with the wild mosquitoes if they are carrying that gene that is going to reduce compatibility or fertility. And the mosquitoes will lay unviable eggs. And then at the end of it all, the population will crash. When the population crashes, then definitely you have fewer mosquitoes and therefore no malaria. Alternatively, you can still be able to still have the populations still swarming around, but once they mate themselves, they transmit that trait of the gene that you want that will make the mosquitoes incompatible in the development of the parasite in the vector. And therefore, they cannot now be able to transmit malaria at all. So those are two ways. So replacing that population or suppressing that population. So one of the things that you really need to understand here is that the effectiveness, it must be effective in the field. And we have to think about safety, ethical issues, as well as environmental acceptability. Then we also need to engage the communities. You need to think about accessibility to the poorest populations. We have field studies that are going in Burkina Faso, Ghana, Mali, and Uganda. And I think they are still looking for more countries that can be able to do that. But in going forward, we have not yet started releasing any mosquitoes at the moment. It's understanding the field conditions, understanding the situation that is required, but then move in to see exactly how the populations can be managed and how they can be able to engage the public, how they can engage the regulatory mechanisms, how they can be able to engage the legal issues that are involved. And I believe this is basically going to be the main talk here. And so with that, we have the final slide that in conclusion, I can say that technological innovations can help us to address the vector control gaps that I've mentioned here. And we know that they alone will likely be insufficient to achieve elimination. And there is rich opportunities for innovation which do we prioritize? So it is upon the countries to make an informed decision. you need evidence. You need research evidence so that you can prioritize the tools that you want. You are not forced to do this, but when you have a battery of tools that you need, then you can be able to do that. Finally, I would say that if you think you are too small to make a difference, sleep with a mosquito. Thank you.
Thank you, Pro. Thank you, Pro, for that wonderful presentation. There's a lot that we've learned today, this session. Myself, coming from a mosquito-prone area, there's several things that I've learned. One of it is I'll start hanging my socks outside the door to attack the mosquitoes. Our next presenter is Professor Richard Mukabana. Mukabana is a lecturer at the Department of Biology, University of Nairobi. He's an African scientist, investigator researching the area of public health, entomology, and parasitology. He focuses on insects and germs that cause malaria in humans. His main area of interest is behavioral and chemical ecology of mosquito vectors that transmit malaria. He has published upwards of 80 articles in peer-reviewed scientific journals and supervised several dozen master's and doctoral candidates. His current work is based in the field sites in the larger Western Kenya. Karibu, Prof.
So good morning, everyone. My name's Richard Mukabana. I'm from the University of Nairobi. I'm very happy to be here this morning, and I would like to talk to you about the gene drives for mosquito control. It's the main topic of today, and because I'm a teacher, I like to make sure that everyone listens to me. So I look at everyone, and I make sure that you're not on your phone, for example, you're listening to me. So just some early comments. We're getting into a very exciting era in terms of science and in terms of biology, and this could just be the next revolution. I don't know how many of you are reading about gene drives, but they offer a lot of potential. I have seen recently a study published where a blind person in the US was able to be treated and they could see color again. You've seen that Chinese study where they were able to engineer twins, that resist HIV. So there's a lot of potential in this field, and I don't know if Kenya or Africa is embracing this challenge. There is so much we can do with this technology. So wherever you sit, whatever you do, you want to know something about gene drives. So let me move on. I'll talk about gene drives in the context of mosquito and malaria control. So just to make sure that we connect well with the previous speaker, these are some of the tools that we use for controlling mosquitoes. Just one slide summary. But I want to zoom into gene drives, and I know that biology was a compulsory subject, okay? And many of you didn't want to study genetics. I'll make it very simple so you can understand how this technology actually works, okay? So this is what a gene drive is. That slide might look very complicated, but I'll try to demystify it. So a gene drive, you can define it in two different ways. In one way, it's just a product. You pick pieces of genetic material, that's DNA, which have got some advantage or disadvantage. Put them together into something that you can call a product or a construct, and that's what you take and put in the organism of interest. Okay? I'll move near here. So here, talking about the product, you're putting something here. This is an enzyme. You're putting some genetic material there that will get the enzyme to cut somewhere, and then this is the region of DNA that's of interest. So for example, you can want to put a sequence of DNA into your genetic material that might make it to be very bright, for example. If we know the gene for brightness or for high IQ, for example, we can do that right now, okay? Not in this room. So in one way, it's a product. What you see on the left, you put together things of interest, and those are the things that you take and insert into the genome. So they'll go in the eggs, they'll go in the spermatozoa. When mating occurs, that product will be spread throughout the population. So here, I use mosquitoes, okay? So you have a mosquito here, which has the trait of interest, and there's one here, which is the normal one. So when mating occurs, you can see at the end of the day, there is biased inheritance. So that product that you're looking for, or that you're interested in, is what spreads in the whole population. So that's about the gene drive. So one, it's a product. Two, it's a process, okay? Yeah, so maybe during that time, as you learned biology, there was something called Mendelian inheritance. Someone called Gregor Mendel, he was trying to breed plants with white flowers and red flowers. So only half could be white, half could be red, as you're seeing there, you know. So if you're going to mate this mosquito, the red one, the blue one, you just have half reds and half blues. That's the normal scenario. But that can be too slow if you've got something of interest. You want to make sure it goes a bit faster, especially if you want to control a disease. You want it to move a bit faster. So the assumption here is that you have a gene, something that codes for that thing of interest, and that gene has got two alleles. Giving the example of where you can have a white flower or a red flower. Okay? This is the scenario where you have put a gene drive into your organism of interest. It doesn't go that way of having half, for example, white, half red. It sweeps across. You can see everything at the bottom is a red, meaning that we have a driver. We have a tool that we've put in the genome that is biasing inheritance towards something that we have interest in. So for example, if we can make our mosquito not to be good enough to grow a malaria parasite in it, then everything in terms of mosquito that comes out of that won't be able to transmit malaria, for example. So that is what we are going towards. So this slide is a bit complicated, but it's the most important for you to understand what a gene drive is. So I'll move near there. I'll maybe this way, so I can explain a bit more easily about a gene drive. So here we have two mosquitoes. One has the gene drive, the red one. This other one is the normal one, okay? During mating, this mosquito will donate one of its chromosomes, and that's the red one here, and then the other one will donate the blue there. Simple stuff, very straightforward, okay? So the problem is, when you check into the offspring, you will not see any blue there now. And what is happening is very simple. This red guy is pushing their hand into the blue guy and inserting some sequence in the blue guy so that they all become red. That's what is happening. And that's what we call a gene drive, okay? Something inside here is getting introduced into that other one, into the blue, so that when we look at the adults, they're all red. And the red is what is the organism of interest. It's the mosquito that we want to use to control malaria. We'll put in a trait of interest. For example, we can make it not to be able to bite you, okay? So it bites plants instead. We can make it not to develop a mouth, for example. You know, you can do anything with these technologies. And right now I'm working with another group of people where we make mosquitoes blind. They can't see you. So we make them not to even sense your smell. They just go around you and they do their stuff. So what I'm explaining here is basically what you see here. This is the red mosquito. You can see we put in something. That's the normal one. At this stage, this thing will cut the other chromosome, and that will allow this thing to enter there. That's what you see. So they're similar, and the product is red. So if you can take a picture of that slide, then you know what a gene drive is. So take a picture, 2 seconds. Okay, so let's move on. So this is sort of detailed biology, genetics, and molecular biology. There are a lot of examples of tools in biology that you can use to push that gene of interest, that trait of interest, into an organism. There's a long list there, and today we'll talk about the HEG, the homing endonuclease gene, which is what people are using in Africa today to see if they can control mosquitoes and ultimately malaria. So I'll zoom into that example. So a lot of things are happening in science today, and sometimes even if you're not a scientist in that particular area, you want to understand them a little bit more. So for what is happening in Africa right now, they are using the tool you are seeing here. So basically, again, I move here. This is a male mosquito, okay? Mosquitoes have got 3 chromosomes. So this is a male mosquito, but there's something here. There is something on the mosquito chromosome which, if it's activated, can just cut off the female chromosome. It just shreds it until it cannot do anything. So this is what you see here in the male mosquito. So if this mosquito, which is modified, mates with a natural mosquito, what will happen is that this thing will be activated, and all the sperms from the mosquito will develop this kind of scissors in it. So when this mosquito mates with the wild one, it will simply eat it, cut it completely, and that organism will die. You can't get an offspring if you do that. That's vaguely what it is, from a layman's perspective. So you met this mosquito of interest with the wild one, and what happens? That wild mosquito will not develop offspring. Everything will die off. That's what is happening right now, and we haven't gone beyond this technology. That's where it is right now. Okay? So let's come back to what is happening in Africa. What are they exactly doing with all this technology so that we can be able to clear the mosquitoes and ultimately malaria? Okay? So what you see here is what we are calling a first generation product. What I've just explained, this is something which you cannot get offspring coming from. You met that mosquito with a wild one and everything dies. At least you know it works. Nothing happens beyond that. That's where we are in Africa right now. We are in the stage 1 or the first generation. So, but this kind of thing can help us in many ways. We can do safety analysis, we can do community engagement, we can do so many things with this product, and we can listen to the concerns that people will have, because we know we haven't done much to the mosquitoes. We haven't done any meaningful release to control malaria or to affect any other organism. It's a very small scale thing. So this product is available. It's been tested in the lab, mainly in Perugia in Italy. But then beyond this, if this works well, the scientists will develop another product, which we call the second generation. So in this particular case, not everything will die. So the the scissors you saw inside the male mosquito will shred the females only, and the males will survive. So there's a very interesting thing about mosquito biology, which might be good for you to know. Mosquitoes just mate once in their life. The females are mated once, and they've got a sac inside them where they keep the sperm. So they can fertilize their own eggs in future, and they don't need the males anymore. Okay? So it's very important. That is mosquito biology. They just met once. You keep your sperm wherever you keep it. You'll be using it when you need it. Okay? So this is a self-limiting technology. It goes on a little bit, and everything dies out. Because still we don't know what people in parliament, people like Okia Mutata might say, you know? So you go carefully. So we don't have that product yet. If it's there, it's only in the lab in Europe or the US. Then eventually, we'll have this thing we call a third generation. We've now tested the waters. We know what all people are thinking, what they are saying, and everything. And this particular one will be able to spread uncontrollably, like throughout the continent, and kill the mosquitoes. Now, this one, I want to say something about this technology. It only targets one mosquito species, because we're talking about mating. You don't mate a cow, for example. A man mates a man, you know? So if you go for one species, that's what you're going to kill. The others, you have to again do this again for the other species. Okay, so for now, we don't have those things yet. So you can see that this technology has a very long way to go. For the first product, the work began in 2007. Then in 2012, countries in Africa were invited to join the study. At that time, Kenya was part of it, and I was the principal investigator of that project. And then Kenya fell out at some point. So we don't have the other two. So from 07 to right now, we have something like 14 years. And see where we have gone. Very little has happened. So it simply means that we still have a lot of years in front of us before we can use this technology for controlling malaria. A long time. Okay? So, why are we using that particular product right now, yet people are dying from malaria? It's because we want to see, Kenya really give us a GM permit, for example. So when I was a PI for that project, that wasn't easy. So the next speaker was the head of the Biosafety Authority at that time, and I went to his office to talk about this issue for a long time. You know, it wasn't easy, because he also has to listen to the bosses in the Ministry of Health. It was not easy at that time until we had to engage them in many other ways to gain some advantage. So that product also, we can use it to teach the African scientists and other people interested just the basic genetics and the basic molecular biology. This subject is kind of difficult, to people, so you need to make sure they understand it. And then number 3, we needed to do things like mass rearing, because remember, you've got to rear so many male mosquitoes with that gene that you have of interest, so they can go and mate in nature. So you must have a very big factory to rear the mosquitoes. These things are very common in the US. If you, in agriculture entomology, you can go and rear some kind of moths that you release in the environment to kill the wild ones, and you can control crop losses. And then number 4, using this product, we also develop field sites. And you'll see in Africa, the countries where field sites have been developed. So we know we can test here, we should make it to be A, B, C, and D, and F, G. Yeah, so I didn't work a lot on this slide, the legal and regulatory gaps, but I found this statement in a publication that the biosafety capacity is either non-existence or sorely lacking. And all of you know that. You've been to school in Kenya, in all colleges. We don't learn about biosafety that much, you know. So, but someone will talk about it shortly, okay? Benefits, first of all, for us as an African group, we get experience. That is important, to know that this thing is there, this is what it can do for us. It can be useful in health, medicine, agriculture, environment. I've seen the UK government again telling the people there, it would be nice if this thing can be used to improve yield, to improve nutrients or whatever within plants. So the last slide, what are some of the concerns or fears or risks of this gene drive technology? So one thing is that we don't know if the modified genes will be stable. But in the small cage from Perugia, where we all had to go again to see what was happening, they were very stable. They were inserted very stably within the genome. And then we don't know if that particular gene can spread to non-targets. Like, for example, I am Anopheles gambi. I have that gene. Can I spread it to Anopheles arabiensis? Maybe yes, maybe no. Sometimes we have hybrids, so we don't know. Number three, what about if the mosquito escapes? How do you get it back? In Bitter Point, when we made that facility for rearing the mosquitoes, we called villagers from around the station and asked them, if this thing disappears, what would you like to see? And they said, I don't even want to see it anywhere. You know, another one said, what tool do you have to collect them back? This kind of stuff. So that could be a big concern. And then number four, will there be some kind of ecosystem imbalance? If you remove all mosquitoes from the ecosystem, that space they've been occupying, will that be good for another organism which is too bad for us? We don't even know. In India, there is at least one religion that takes a mosquito as a sacred organism. It's sacred, don't touch a mosquito. There's at least one community. And then there are transborder issues. When those guys are working in Lake Victoria in the islands, will those mosquitoes spill into Kenya, into Tanzania, into Rwanda, Burundi, and what will be the responses from the other governments? So that is all from me. Thank you for listening, and maybe I'll take questions later. But I expect to have a dialogue rather than questions. We'll see what you'll say when the time comes. Thank you.
Thank you. Thank you so much, Prof. Thank you, Prof. May I request the presenters maybe to come forward here for the sake of the media. All presenters, may I request to come and sit in front here for further questions and answers and responses. Yeah, we are going there next. So our last presenter for the day will be Dr. Willie Kiprotich Tonui. Will be presenting virtually though. Dr. Willie Tonui is the Chairman and Executive Director, Environment Health Safety, a consulting firm based in Nairobi, Kenya. For his distinguished service in biosafety, he was recently decorated with the Elder of the Order of the Burning Spear by His Excellency the President of Kenya. Karibu, Daktari. In the meantime, please access our Twitter handle at @HTP_Africa and make your comments. I've seen several tweets from several members of the Editors Guild here. Please continue accessing the Twitter handle at @HTP_Africa. Thank you.
Okay, I hope you're hearing me now. Are you hearing me?
A bit.
Hello, are you hearing me now?
Hold on a bit.
Are you hearing me now? Hello?
Go ahead, Dr. Ari, go ahead.
We can hear you. We can hear you.
Okay, okay. Thank you very much. The title of my talk this morning is that I'm going to give you a short review about the frameworks for gene-derived research in Africa. I know my good friend Richard has talked a little bit about the regulatory frameworks in Africa. And my talk today is going to share about this policy and legal frameworks that are currently available and gaps that may be available. And also to speak about the ongoing efforts to address the gaps in the regulatory frameworks, as well as to strengthen technical and regulatory capacities for gene-derived research on the continent. International laws guide the establishment of local laws in every country. And in the field of genetic biocontrol or genetic modification field, the Convention for Biodiversity, which originated from Cartagena Protocol in Biosafety, is the international agreement that guides the development of countries' laws through the domestication of this Cartagena Protocol. And the Cartagena Protocol also has developed a liability for damages, which is a supplementary protocol under the CBD. 171 countries are already parties, and this protocol is concerned mainly with the biodiversity, governing the movements of living modified organisms. You removed my screen.
Doc, we can't see your screen. Let me
Okay,
share for my end. Let me share for my end.
All right. So I'll start again then.
Yes, please.
Okay, sorry about that. Can you put it on presentation mode? Okay, so sorry about that. I think you can now see my screen, right? Yeah, so I'll go back again, and my talk is about regulatory frameworks for gene-derived research in Africa. And please, next slide again. And I'm going to talk about the policy and legal regulatory frameworks leading to gene-derived research for malaria, and also talk about some of the gaps that may exist, and also efforts to address these gaps in the regulatory frameworks in the continent. Next slide, please. Yeah, most laws are in a country are adopted from international laws or agreements. And the agreement that is applicable to genetic modification or genetic engineering, biotechnology convention is the Cartagena Protocol in biosafety. And also it has a liability for damages protocol, that's a supplementary protocol. And next slide. So the Cartagena Protocol is concerned mainly with the movements of living modified organisms resulting from modern biotechnology, specifically those potential adverse effects on biodiversity or human health. And so far, 171 nations are parties, including most African countries. And from the last CBD 14 or COP9, there was a question of whether the gene drives are going to be classified as genetically modified organisms or not. And therefore, this meeting was very instrumental in making a decision that indeed, gene drives are going to be regarded as genetically modified organisms, just the same way you have for crops and others. Next slide. So the intended use of gene drives will be determined by national laws or policies. In countries, we have laws that govern pesticide or biocontrol or health in most countries in Africa. And most of these countries, they already have biosafety laws or laws that govern pesticide. And Nigeria is the only country in the world that has amended their act to include emerging issues in biotechnology. And they have included biosecurity, gene drive and gene editing as part of their sections in their act. So other countries, as a gap, is still most countries are still either reviewing or developing their guidelines on gene drives. Next slide. So as you can see in this table, most of the countries have adopted their policies on biotechnology. And these policies have been documented into laws. And most of these countries do have biosafety acts or national environmental management acts. And these laws are implemented through regulations. So if you can see the countries of interest here, Uganda has been developing a national biotechnology and biosafety bill for a while, but recently they do release an environmental act that is able to support gene drive research. Other countries like Burkina Faso, Ghana, and Mali, they do have safety laws already. Next slide. So as Mukaban has given in his talk, through the pathway, any decision to move through the pathway has got to be approved by a regulator. And any release of a synthetic or any gene drive has got to be made on case by case. And this is done following a comprehensive environmental risk assessment, which includes taking ecological as well as evolutionary modeling. Modeling is a new discipline that takes consideration into the potential of a new product in the market by use of modeling. So this is an area that needs to be considered for gene drive, unlike other diseases. So during decision-making process also, clear communication and public engagement is very important, as some of the communities involved have got to take a stake in what is going to be done. And regulatory agencies have got to have communication guidelines, and also guidelines that support public engagement. And all the other issues, as Charles had mentioned this morning, is that implications of synthetic gene drives also have ethical or socio-economic considerations that needs to be considered. Next slide. So it is mainly the competent authority, which in this case may be a biosafety or environmental regulator in a country, that makes the decision. And for us in Kenya here that have biosafety laws, we have a biosafety regulator. And the biosafety regulator is the one who is responsible for approving research or development of a given genetically modified organisms or gene drive. And once this regulator has made a decision, other regulators also have to come in place also to support product-based approval processes. So in Kenya here, we also have NEMA, which is an environmental regulator, also Ministry of Health, and also the Pesticide Control Board is a biocontrol regulator, which will be very important in the decision-making process for gene drive. Next slide, please. I'll talk briefly about the positive developments that has happened in Africa towards research and development of gene drive technologies in the continent. Next slide. As you have heard from previous speaker, NEPAD, the African Union, NEPAD has been playing a big role in supporting the policy development for gene drives. And very recently, they released a document, Gene Drives, Malaria Control Elimination in Africa. And this was done through the high-level panel that they have. And this panel concluded that given the potential of this technology vis-a-vis the threat of malaria, it is imperative to comprehensively examine the technology And that's why, through the efforts of NEPAD, gene drives have been a conversation in this continent. Next slide, please. And NEPAD has continued to support development of gene drive technology through publication. As you can see on the slide, there's a document on strengthening AU member states. And this is to ensure that research and development of new technologies are conducted in a responsible manner in the continent. And NEPAD has been supporting many countries, either to support review or development of guidelines on gene drives. And they have also been hosting a series of workshops in the continent, as you can see in that publication that was released as given in the different Malaria channel of 2019. Next slide, please. So I'm currently heading a consortium, and this is a consortium of non-state actors that was officially launched on 30th of November last year by not-for-profit organizations who include the African One Health Network, African Biological Safety Association, Multilateral Initiative on Malaria, Network of African Science Academies, PAMCA, and Gene Convene. This is an organization for non-profit organizations, and they must have a presence in Africa. Our next slide, please. Our mission is to expand African self-determination of the course of research, development, and use of genetic biocontrol tools for animal public health and conservation of wildlife and environment in the continent of Africa. Next slide. Next slide, please. So the goals of the consortium is basically to strengthen communities of practice. So our role is to promote best practices in research, best practices in regulatory policy and stakeholder engagement, and also during the implementation of these policies involving genetic biocontrol. We also hope to use the genetic consortium, to expand a number of people with understanding and engagement of genetic biocontrol approaches. And through this, we hope to amplify the influence of African organizations, communities, and individuals on genetic biocontrol approaches. Next one. So we have a strategy already, and we have already initiated a series of interaction. The consortium basically was established to promote greater interaction among stakeholders, whether scientists, regulators, or policymakers in Africa. And our goal is to support oversight committees in institutions. These institutions, like institutional biosafety committees, are responsible for regulatory application and dossier documents. Also developing risk assessment tools for decision-making process, developing consensus guidelines, on regulatory policies, for example, ethics, public health, public engagement, facilities. I know Richard talked about facility development and field trials, post-release monitoring. And these are areas that we are very keen in supporting. Supporting development of ethical best practices, helping facilities also be compliant with the international standards and accreditation standards, and also making people aware about the training and regulatory best practices. So we are also helping in maintaining a central resource. And with this hope that these strategies will lead to increased number of in-country expertise in science and regulation. I think on the floor of the meeting, so we have achieved a lot of issues, and we have an very interactive website. The unique thing about our website is that we have translated our website information into French, Portuguese, Arabic, and Swahili. And even our newsletter, which we release weekly and also and monthly, has been translated into French and Portuguese. And we're also very active in social media outlets, and you're welcome to interact with us using this media. Next slide. And we have also initiated a series of webinars in order to support capacity building efforts in the continent. Our first webinar was done last week, and very soon we'll be putting this in our website. And the next one will be on 28th of October this month, and we'll be talking about translating research to commercialization of genetically modified products. And the unique thing about our webinars is that we do have a series of topics that we discuss, and also a series of discussing points that we're going to have eminent scientists or eminent regulators talking about various aspects of genetic biocontrol. Genetic biocontrol, in our case, we are dealing with gene drives, we're dealing with gene editing, we're also dealing with genetic modifications of that's applicable to medicines or any biotechnological products. And therefore, you're welcome to register with us and also to talk to us, and we'll be happy to discuss any issues relating genetic biocontrol to these webinars. Next year, also be on lookout. We are going to start some courses for our scientists, and whereby we are going to give certification. And also we are considering also issues of accreditation, of genetic biocontrol experts. So I want to thank you for listening to me, and also I'm happy to answer any questions that may exist. And should I not make it finally, there's my colleagues on the floor, Tibet and Kimberly, who can be able to help me answer some of these questions. Thank you very much for your attention. Thank you so much.
Thank you, Daktari. Since we run out of time, it's 10 o'clock now. I think I'll just request that we contract for another 30 minutes for question and answers, and for the wrap up and next step session. So it's question time, comments, responses. At this time, maybe I would request the presenters to come forward now. Any questions, comments, responses to our wonderful presenters?
Good morning. In Bogo's earlier presentation, he mentioned something interesting but didn't conclude it. Interested in technology that he had mentioned in construction of houses to ward off mosquitoes. What technology is that one? Then now this is a general one to the two gentlemen. You had initially said that Africa bears about 90% of the disease burden caused by malaria, by mosquitoes. Yet WHO identified only 3 countries in Africa in its E2025 initiative aimed at declaring those countries malaria-free by 2025. How did Kenya miss out? Then, given that the milestones we've made so far in fighting malaria, then the technologies that you are presenting today, are they borrowed from countries that have already been declared malaria-free by WHO? If not, what more did they do that we can copy from?
Yeah, can we answer the questions or?
Go ahead.
Okay, thank you very much for that question, which I mentioned on passing. This is in regards to house improvements. And what I meant by house improvements is that we need to bring in other stakeholders like architects, engineers, still on board because mosquitoes breed in and outside households. And we need to see exactly how can we improve the house to prevent mosquito entry into the houses. For instance, we have what we call the eaves, where majority of the mosquitoes enter through. And we also have the size of the windows that you also have. Research has actually shown that if you build a house with big windows and so on, that helps a lot of air circulation, then definitely you'll not get as many mosquitoes as when you have small windows, because you are building in carbon dioxide inside that house, and that is the attractant for the mosquitoes. So basically, we have a kind of a program we call BOFA, Building Out Vectors in Africa. And you can visit that website, www.bova.com, and you can see exactly more about what we are talking about when you bring in other stakeholders, environmentalists, bring in architects, so that when you are designing the house homes, and especially government engineers also, then we can be able to bring this in place and ask the people as they do this, they can be able to improve on the house, because it has been sold. It actually reduces malaria in areas where houses have been properly built. Thank you.
Yeah, so there was a question about the technologies that are being used, the gene drive, I guess that we're talking about, where we're borrowing the technology. Are those countries malaria-free? That was the question. And then if they are malaria-free, what can we borrow from them? So this technology that we are going to use for malaria control in Africa, the gene drive, which I don't even know when it will mature, is something that has been made in Europe. The work has been done at Imperial College, initially, the scientific conception, and then the other things like the cages you're seeing there being done in Italy in a place called Perugia. These two countries are malaria-free. They became malaria-free long time ago. They have basically used things like larviciding and to some extent house improvement to control malaria. So at this moment, we can borrow the technology, but we can't borrow the experience of using the technology for controlling malaria, because this is not what they used to control the disease. Italy had a big issue with mosquitoes. Even central London had a big issue with mosquito control. And what they did there was environmental management. So you dig holes like 20 meters underground in the city, and all the water gets there and it just disappeared. They never used gene drive technologies. So that's the answer to that question. Now, the other question was about why Kenya was not listed as a country which will become malaria-free. And I think by definition, Kenya still talks about malaria control, not so much on elimination or not so much on eradication. So if you talk about malaria control, it means that you've locally agreed that malaria cases should not go beyond a certain number. That means you're accepting the disease. If you go to elimination, you want to say everything out, but will sustain surveillance, you know. So by definition, we're not at a point where we can say, as a country, we are going to have malaria elimination right now, because we're still talking about control, and control means what are we okay with as a country 2 people dying is good for us. Means that we're not looking at eradicating the disease any soon. So thank you.
So I'm not answering the questions, but I actually have some questions that I would like my colleagues here to respond to that are of interest. One of them is broad in terms of looking at all these technologies being developed for malaria control and elimination. Could you comment on whether there is any one of these tools that can eliminate malaria, or are we talking about a combination of many tools? And what does that mean? Because there's a lot of narrative around eliminating malaria, but what is it going to take? Is there one magic tool, or is it a combination of many tools? The other question that you should also respond to that is, I think, important for this conversation is opposition. Now, when you zero down to this work going on gene drives, and we note that there's a lot, the gene drives research is only starting, right? There's a long way to go. And so the conversation is not even on whether African countries should be thinking of adopting it, but creating space for the research to be done, for the technology to be tested. There's a lot of opposition and concerns and fears. Are these founded? How, if you are sitting here with the people who are opposed to this technology, what would you tell them? Are these founded on evidence? Should we worry about these concerns? Are these mosquitoes going to start transmitting other diseases if they stop transmitting malaria? So there are all these things being raised. And then my final question is that Kenya was not supportive. You tried to start the gene drive work in Kenya for 4 years, but you didn't achieve much. Could you say a bit more, like, what does that mean? And is there any role for us sitting here as Kenyans, as the media? What was that, and what does it mean for this type of research in the country? Thanks.
Okay, thank you very much for those questions. One, the main question is actually, we have quite a number of tools that are available. And the question is whether we need to use all these tools, or we need to use a combination of them, or what do we do? I would say this in very clear terms, that we need what we call integrated approach. There is no single bullet using a single tool. I told you exactly the gaps that actually are there, especially if you are using long-lasting nets, especially as an example for a tool, that there is still a gap where mosquitoes still get access to the people. And in that case, then you cannot use net alone. You need other tools that you can be able to integrate so that you can be able to cover that gap. And so this will depend country by country and depending on the local situation. And so every country is supposed to subject the tools that are available and see which ones are better for them to use and how can you be able to use them. The moment you do that, then you are guided by your strategic plan in order to understand how you are going to use these tools. For instance, in Kenya, let me take Kenya for instance, that we have now distributed over 10 million nets, and yet malaria is not still going down. For how long are we going to continue distributing nets? We have not had larval source management in place, but thank God now that the new strategic plan approves that we need to introduce larval source management, whereby you need now to spray in those areas where mosquitoes are breeding, and especially starting now in the 8 lake endemic regions. That's where it's going to start this year. And that is now in addition, and I said this is a complementary tool that you are going to use there. So that now when you are outside there, then you have fewer mosquitoes maybe biting you. And you have now this complementary tool that we are using. In addition, we also need to fight the gap where we have insecticide resistance, where nets are not now becoming very effective. Although the nets still become effective even if there is resistance because there's a physical barrier, but you need other tools like spatial repellents you can use if you're going out, apply them on your skin, or wearing low clothes and all that. But some of these things are not things that you can scale to the large scale level. But at that level, you really need to have what we call the integrated approach, so that you can bring other tools based on evidence so that you can be able to reach the elimination goal on that area. So on to the question.
Okay, let me respond about the Kenya project and why it didn't continue here. So when this work came to Africa, that was in 2012, they selected 4 countries, Kenya, Uganda, Mali, and Burkina Faso. So basically 2 Anglophone and 2 Francophone countries were selected. So the work in Uganda and the West African countries all went to government institutions. In Kenya, the work was based at ISIPE, and I was the PI of the project there. I was the head of the Human Health Division. So, and this project had been conceived when we had a different director from Europe, and when he was just exiting, we got a new director who thought that it would be very difficult for ISIPE to fight wars around transgenic technology. So normally, when a CEO goes for meetings to other countries, other organizations, sometimes they ask PIs to give 1 or 2 slides so they can give an overview about what they do in the organization. And every time I gave slides for this particular project, they were never in the package that went to talk to other people. So in terms of the institution, we did not have the support for the institution. By the new director at that time, she's still there right now. And many times she called me to the office and asked me, how are you going to sell this project? You know? And let me tell you, if you're having a project like this in an institution, it's not about you, the PI. Actually, this is something that the director themselves must know, almost word for word, because they have to defend the project with the accuracy and clarity that the PI has. So they have to be very interested. But she just thought, no. She had come from South America. She had worked there a little bit, and she was actually in Colombia. And she said it was hell when they had a project with this technology there, and she didn't want to get back into those kind of wars again. So it meant, therefore, that whenever I could go this project outside the institution, it was my issue. It wasn't an issue for the institution. When I think about the Kenya government, like Willie Tono is here, he was the head of the National Biosafety Authority, and we had early beginnings with him in our academia. He was very receptive. He was very frank to tell me, "Bwana unajua hatuna framework, you know." And then we talked, and he said, "Okay, is there a way that you can help us build our capacity?" And together with the team from Imperial College, the people from NBA here were able to get training, even trainings that were not project related, like they could just go for a different thing, so long as they could get 1 or 2 things in terms of experience. So from that perspective, I think the government was supportive, you know. Also, we, of course, had ethical clearance for this project from KEMRI, so that is government support. But our big issue was institutional. And sometimes I therefore pose the question, can you run a GM project as a foreigner in another country? That can be very difficult. So these things sometimes need the local voice so you can really move with it. So that's what happened in that scenario. My gut feeling, is just my gut feeling, and Rose, it's good you're here. My gut feeling is that they might come back through you people, you know, making another consortium. That's my gut. I talk to them a lot, we talk a lot, but that was the issue that we had. And I can imagine, even if I was the CEO, I would get worried sometimes because we didn't have the framework. Here, there were all those fears from communities and everybody else. Many things we asked for in terms of an important regulator, some of them were not even there. So that's where we were coming from. So thank you in terms of that question on the work not continuing in Kenya. But I can say nonetheless that they had done a lot of training. We had built a facility in Beta Point. Internally, it was a lucrative project. Someone promising you like 15 years of funding. Where do you get that in research? And they were very generous funding. Yeah, so that is as per that question. If you have an extension of the question, I'd be happy to comment. Otherwise, we can go to the next question. So, yes, please.
Thank you. We've seen countries like Uganda, Tanzania hugely participating in the malaria control trials ongoing. But then when it comes to Kenya, presentations, especially on the gene drive technologies, presenters are saying that it could be a game changer. But as far as we are taking part in the journey of malaria elimination, does this mean that our priorities are not right as a country? And what will it take for us to be in that space?
Very difficult question. I'm a Kenyan. I hope you're a Kenyan also. African countries, as you know. Kenya is the countries. Now, number one, Kenya has been ahead of many African countries for a very long time. If you go to the European Union, you'll hear that Kenya has been taking most of the African money for many years. We had capacity very early, we got most of the money, and we seem to be, not getting as many grants as possible. I'm sure that some people sitting on my left will say that, yeah, Malawi is doing a bit better, Even Zambia, they're doing a bit better. So there's that issue of traditionally having had a big percent of funding in the past, and things also changing right now for Kenya. I think there's a lot of drive from the people. People really want what they want. I was very happy when Rose put up this slide that put up the gap in the teams that are here. I was expecting that there would be government here, It's always important in these meetings to have government. They'll tell you the legislation that might be there or why a draft document is sitting somewhere without approval or something like that, but it's a very big issue. I will deviate a little bit and give you a different story. So in 2019, you might have seen that Zanzibar used drones for mosquito work. Did you see that in the media? I was the person who was on that project again, in Zanzibar. And it took us 5 years, it actually took me 5 years of going to every single place in this country, and I never got a permit. I went to Cambridge, and they gave me ethical approval, but they said in that approval that we want to see if the aviation authority has approved you before you can go out with this letter. Then Cambridge sent, so when I went to civil aviation, they told me, go to the Ministry of Defense. The Ministry of Defense only gives you a consent. So in the Ministry of Defense, what I did, I wrote the application, gave it to them. Within 1 day, I got a rejection, which is rare speed for Kenya. We don't have that speed in government, Then what I did, I spoke to the Vice Chancellor of the University of Nairobi. I said, why can't we go as a university, so you be the applicant? It went to the Ministry of Defense, and we got consent. Just like that, in 1 week, okay? Then I went to civil aviation myself. I spoke to all those officers there, and they told me, as far as we are concerned, we have a draft that is pending to be discussed in Parliament, so we are not approving any drone work right now. So then we began thinking internally in the project, what can we do? That's how then I talked to colleagues in Tanzania, and within 1 week we had approval. We went to work in Zanzibar in a place, I don't remember the name of that place, but we went to work in Zanzibar, very good results, and the whole world was there in terms of journalism. Maybe some of the people were there here, in that meeting. So we've been thinking again back and forth, and you saw the president recently using a drone in Kilifi. Again, I've been part of that system until the president did that, but then we had to talk to people here and there and ABCD. Samia Suluhu herself, is approving that we have to go back to Zanzibar and do that project for 10 years so that Zanzibar becomes mosquito-free and a good tourist destination, which I don't see here. So the framework for Kenya, it's hard for me to get the correct words to tell you, but I think it's a mixed bag of things. I am an officer, but I can never take a decision because I'm looking above me. If I'm above there, I can't take a decision because I'm looking at the votes, you know? So it's really a difficult question, and maybe nobody will talk about it like I'm talking. You want to hide a little bit when you speak these kind of things, but that is where we are. And I fear, personally, that all the gains we've made since independence in terms of being at the cutting edge of things are quickly getting lost in this country. I don't think I've got a better answer for you, but that's what I can say. There was a hand elsewhere.
Sorry, my name is Vinnie Kamau from South Africa. I totally feel your frustrations. In terms of even using the drones in Kenya, it's really hard thing. You can ask even the cameramen who are here. But I really appreciate that Tanzania is making that milestone because they've always had the project which was run by Huria Ramani, and they even have the first drone. Your explanation, can you be able to even assure us if we were to help you push this going forward and having Kenya come back and gain its status, are there any risks involved? Because I would be scared if we'd go the Zika virus way.
Okay, so I'm not exactly sure what I should tell you, but I've been on the forefront of the drone work in Kenya. And right now there's one company, it's called Astral Aerial. That is part of Astral Aviation. So the father owns the aircraft, Astral Aviation. The son does Astral Aerial, the drones. Those guys now have a license from the Civil Aviation Authority to fly drones consistently. Maybe they'll renew after some time. So we've worked with them a little bit. So the things are changing there. I think also in terms of legislation, there was a bit of change there. But of course, after a lot of years of sitting there and nothing happening. It's just that if you want to, so those guys have their own drones. Now they're talking about a T20, T30. They have them in Westlands if you go to their office. And they're working a lot in Kitale to spray the maize farms with fertilizer, a lot of things, you know. But that is now a businessman, okay? People that might be funding government in a way. For information, Astral Aviation are the guys who bring in all the vaccines. They are received here before they go to South Africa. So there might be, you know, some link there. I don't think you need to get scared about talking to government. Sometimes I can be a government officer and I don't have information. And I think as media, you have this legitimate role of making sure that you put things the way they are, so long as you get the correct information. I don't think you need to be. I mean, I'm a biologist. When I see the content of biology from developed world universities, they have a lot of these gene-drive things, synthetic biology, this kind of stuff that we don't see here completely. Just because we don't have the money, we don't have like the little things to do. If we don't make noise, we'll be left very far away. So some noise is important, I think. Yeah. What? Oh, yeah, Zika. We were interested in viruses that are spread by mosquitoes. And we did collections of mosquitoes from most of Kenya. And the infection rates of mosquitoes here is extremely low for those arboviruses. If you're talking about dengue, it might be high, but we're talking about 3%, 5%. So Zika will be really something small. Despite the fact that it came from Uganda, which is nearby, that's the origin of Zika. It's in Kenya, fine, but it won't be that big issue. Kenya, I think, is a country whereby if 5 people die is not an issue. That's the funny thing about our country. So I wouldn't be, from the Kenyan standards, I wouldn't be so scared, but we need to do something to make sure we don't get any disease here. So we can deviate those budgets to more pressing issues. Yeah.
Thank you. My question goes to Professor Mbogo about the malaria vector. I don't know whether this is my question goes to Professor Mbogo around the malaria vector. I've heard some people say that mosquitoes, especially the ones that transmit malaria, can be ferried in maybe vehicles, buses with passengers who are coming maybe from malaria zones like Western. And then they can start transmitting malaria in areas like Nairobi or any other areas that do not have the malaria transmitting vector. Is this scientifically proven or is it a myth? Thank you.
Okay, thank you very much about that. Mosquitoes knows no boundaries, and they can be able to access any place, anytime. And therefore, if you're coming or driving from Western Kenya, where we know mosquitoes are there, you may come with a bunch of them in your car, in the boot, anywhere in Nairobi. And definitely they'll come out and start breeding in Nairobi. And then you start seeing malaria in Nairobi. But there are several other things that you have to think about, whether they are going to have local transmission taking place or not. Biologically, if the mosquito cannot be able to survive in that area and help develop the parasite to the end, then that mosquito will not become infectious. So yes, you can be able to carry mosquitoes from one place to the other. Even from Africa to Europe, you can take them there. And you have heard about malaria, airport malaria. This is airport malaria because maybe you have taken mosquitoes from here to London, and the mosquitoes are living there, they find favorable conditions, and they start transmitting. So it is possible that way. But if the environmental and other temperature conditions does not allow, then that mosquito will not be able to survive. But if it does, then definitely malaria will be taken off and it will be transmitting in that area. Thank you. I hope I've answered your question.
I would just like also to follow up on some of the thoughts that were shared by my colleague Winnie, and also listening to Dr. Mkabana, looking at opportunities that are there to report on malaria, especially as you're talking of the advances that you're making behind the scenes in the labs and all that, and how much of that is getting out onto the national or the platforms or spotlight. And from your end, if you can talk a bit about how much attempts have you made at getting allies, especially from Southern Asia, looking at collaborations to tell some of the stories that you have? Because as you know, media plays a very critical role. But then at the same time, this information, trying to make sure that we sustain it or we remain with it. Like for instance, the gene drive matter, how Kenya just got bumped off. Did it ever get out? Do we know this? How much of that would you have put out? And going forward, would you like to look at opportunities to try to sustain this kind of discussion? Because it's where we're going into. We don't want to be left behind as a country. You play your role, we as media also play our role. Can we work hand in hand closely? I know perhaps we'll come to the next steps later, but for now, just like, this is really burning question. You can't just slow the south up and slowly go
Anyway, so thank you for not moving from where you're standing. I'm a person who thinks about strategy every time, and I look for opportunity in whatever I see near me. I know that AFIDEP will do a report that attended this meeting. So basically what you're saying, we would like Kenya to remain on board, which is a good thing. The donor for these projects listens a lot, okay? For example, this person would say, to answer a different question but connect to yours, someone talked about the opposing forces against this work. This person would say, okay, let's try to do a survey of all the issues raised and see if they are evidence-based by carrying out our own local research and saying, someone has told me about this thing, it doesn't make sense. Sincerely speaking, the things I hear the people talking about gene drive, most of them are not properly founded, sincerely speaking from my end. But I still think that in terms of talking to the media, I have been talking to the media for a long time, but in ways that the media came to me. I didn't go to the media. So the story that Charles talked about in terms of a mosquito biting the leg, that was my PhD project, That is the biggest weakness for a scientist, talking to the media, and I think that's the niche that AFIDEP has taken up, which I think is very highly commendable. So it will be useful, for example, as a recommendation to think about more funding to enable this meeting to take place again. It would be important, maybe even for the media people here, to visit some of the field sites as a recommendation of what's happening in Africa. Maybe they need also to go to Perugia in Italy, just a select group of people from here to see what is happening there, and saying, look, we've seen everything that you're talking about out there, and we can do it. Try us again. This is how we are going to be organized this time. The donor for this project is very sensitive to any opposition, and they would really like to see evidence that will counter that opposition, like real good evidence. So I think that is something I would say, take it as a recommendation. It would be nice, for example, to have Austin in this meeting, Austin Butt, or maybe the other guys in the group like Nolan, just to speak about the thing. They're the ones who developed this technology. If they're here, it makes a big difference also, even in terms of the accuracy of the information that we get from this meeting. Thank you.
Just maybe let me add one or two things that I thought is important and thank AFIDEP for the role they are actually playing. Where we did a little bit of a capacity assessment all across Africa in 2016. And at that particular time, we are trying to see exactly what kind of capacity is available for vector control. And especially we are looking at the entomological capacity assessment across Africa. So we hence sent questionnaires to about 45 African countries. And what we found was actually very interesting, that in Africa, we have a lot of capacity. Present, people with PhDs, masters in all this, but they are wrongly placed in the wrong places. So we don't utilize, and they don't utilize what they have been trained to do. And so the question is, do we train for the sake of training, or do we train for helping the countries to achieve the strategic objectives that you have? So those are the questions that we keep on looking at. And then we also found that Africa has a lot of data. And therefore, we need a lot of teamwork to look at all this data, analyze, synthesize all this data, and make proper evidence. And we can be able to end up with very good tools that can help us. For instance, let's take about an example like Kenya. When I looked at the vector and distribution patterns in the country, I found that since 1900, only data available was within the research institutions. In Kisumu, in Nairobi, and in the coast. Little data was available in the rest of the counties. And therefore, we recommended to the Ministry of Health, the National Malaria Control Program, that there is need to collect more data to understand where mosquitoes are coming from and what is being transmitted. And they listened to us, and they started that vector surveillance in the country in 2015, 2016. And the data now they have is quite a lot, and plus whatever data was there. But we need to analyze this data in combination with the data from the epidemiological outcomes, together with the climate data, so that we can make informed decisions whether we are moving from control to elimination. If you look at the National Malaria Control Strategic Plan 2020-2024, it talks of malaria elimination in Kenya in 4 counties at the moment. And the 4 counties were actually named. And we wondered, how are you going to eliminate malaria in those counties? Knowing that mosquitoes know no boundaries, and they'll be crisscrossing the counties, as we have talked about. So we need to have very clear data and see exactly how we mean to look at that. Start with our own data and integrate that data, and let's see exactly what is actually required so that we know the next move that we can be able to do. Thank you.
Yeah, but thank you. I've got 2 questions to Prof and Gabana. You talked on a range of technologies, and most of these ones, as you are talking, are anchored in the West. I was just wondering who is going to have the IP for these technologies once they come to fruition. And the other question is, what's the level of know-how exchange between the guys in the West who are sponsoring these things and the African researchers, or the African researchers are left to do the fill in at the end of the tunnel of the work itself? Thanks.
Okay, thank you very much. I think that's a very, very good question. And I think Dr. Mukapane or Professor Mukapane will be able to give more details, and especially in regards to this. But there is one thing that actually was developed way back, and this was African Voice in 1996 in Senegal. That is during the birth of the multilateral initiative on malaria. And we were called as African scientists to go and make a commitment on how malaria is going to be defeated in Africa. And thereafter, the birth of the Lombard malaria came in 1998 because of that development that we have. And what was actually discussed is having what we call true partnerships. This is key. If you don't have true partnerships and effective partnerships, then you'll not have what is called transfer of technology. And so we started by what we call North-South partnerships, where you have people from the North, or what we are referring to the European countries, and another PI with equal responsibility from the South to mentor them through so that they can now be able to take over that. And then after that, then we also had what we call the South-South partnerships. How effectively do we partner Kenya maybe with Cameroon or with Senegal or others. But we find the majority of the partnerships is actually north-south. However, although this is actually taking place, it is not to the satisfaction that was put in 1996. The reason for this is because the African governments have not taken their share, especially in financing research. This is actually one of the major problems because the main funding research of any type normally comes from the north. And until we get that commitment from the African governments, I think we'll be talking something different. Maybe you can.
Yeah, so let me add on. The IP for this technology will not be for an African, just to be blunt, because before they came here in 2012, they had already had 5 years of work and developed the technology. So we can't take it, we can't take the IP here, you know. And I also think that as African scientists, we are a bit weak, just in taking things to the next level. Like I have developed something, it's working so well, once I publish, it's done. And I don't know how, as a country, we are in terms of IP, even in the institutions. I think it's a weak link within our institutions also. So IP won't be ours, I can tell you for sure. Even in cases where we were able to develop things that needed IP, for example, when I worked on the smelly feet, we discovered chemicals there that can attract mosquitoes and keep this place mosquito free. We began thinking about IP for those chemicals so that we can produce the products and people can use in hotels and everywhere. We tried here, we tried the Netherlands, we tried the US. At the end of the day, we got the IP from the US. Here it was a bit, the path was not very clear about getting there, you know. So yeah, so in terms of IP, it's a weakness. We need to work on that as a country, I think. Okay. You have raised an important issue about the difference in know-how between the scientists in the developed countries and Africa in terms of this gene-driven technology. And I think there's a big difference. Number one, when the proposal was done for this project, there was no African on the table. Okay. They approached African PIs after they got the funding. And also in terms of technology, I mean, I've been to the lab at Imperial College. Those are things that of course can be done here, but there are a lot of issues in Kenya right now that prevent doing advanced work. For example, yesterday when I was trying to finish on my PowerPoint, I didn't even want to call AFIDEP. Power went off at 8, it came back at 5. How do you keep an enzyme in the fridge? I didn't even want to call AFIDEP about that. I just said I'll do it my way. You know, that's a very basic thing. Your tap will be dry, you know? So a lot of those things can't work. One time when I was working in Chiromo, they locked the building and I called this guy, he told me I'm asleep. Simple things, you know? So we can want to be at that level, which is good, and we should try to be there, and we should increase our voice in terms of making sure, okay, we were not with you in the beginning, but we want the capacity to be completely the same so that we can also share it locally. That is a big difference between us and them. And I know as PIs on that project when it began, we raised that issue very loudly with the people in the north, and it was all very receptive. They didn't have issues. They gave us all the opportunities. You know, but then sometimes taking up those things here, we just fail to do it. And actually through that I realized that, for example, let me use this term, the non-Kenyan countries are very receptive. Here things are very difficult sometimes. I go to the principal of the college, I say this thing is coming, it becomes my thing. You know, it doesn't become institutional. When we go to UVRI in Uganda, Professor Mukwaya wants to say, can you tell Museveni this thing? I can call him right now. You tell him. Very big difference, you see. You go to Burkina Faso, as I said, the minister comes to the airport. Same with Mali. So we have a behavior that we have cultured. I think it's very strong. You see everybody resisting a Kenyan anywhere you go. So I don't know, but then there's an issue here that is cultural. It's becoming very strong, you know. Yeah. So, but I think in terms of that issue of making sure that the North and the South are the same in terms of technology, I think that should be a recommendation that comes from this meeting. It's an important one. It was raised internally in the project. It needs to be louder. We want to see from those African PIs, are the people near them getting the technology also? Or are they just hands that are doing the work and we can't do it on our own? Thank you.
If the IP is with the folks in the West, then I'm just wondering about affordability for the end users, because at the end of the day, an innovation is only important when the end user can access it. So if these things come to fruition, how possible will the end users have them? Because IP is so significant in production, dissemination and accessibility. How does this one sit with the African people who needs this thing, most of whom are very poor?
Let me respond to that just quickly. For this technology, things might be very different, you know, because once we've got the final product, the third generation, which is like, which spreads on its own, it should do the whole continent, you know, and that's the eventual aim of the project. After, I don't know how many years to come, 20, 30, 40, 50, I don't know. The end of the game will be that the product now comes, it's put in some sentinel areas, and theoretically that should be able to control the disease all over the country. And I've actually seen Bill Gates' commitment towards that. Things might change, he's becoming less rich, so things might change. But it's also, the issue of IP might not be very big here. I don't expect to do a business whereby I'm keeping a gene drive and selling to people. I don't think I'd get any market for that. Also, if you look at Africa, most of the things we do in the health sector, they are things that are not funded locally. They just come as some goodie to us, and then we do it that way. Yeah, thank you.
My name is Samuel Maina. I have one or two questions. The opposition to some of the initiatives to eliminate or control malaria, could it be business interest? Because we are talking about, we have been doing this for many years and we are not succeeding. Could it be business interest? Number two, many media houses represented here and those who are not represented here, we have acres and acres of airtime that we spend on useless things like politics and music. You have the guy who summoned us here is called Duba. Can we get into coordination where you give us experts in our media houses to talk to our people about these things, and especially vernacular radio stations and TV stations? Why? The counties you are talking, or regions you are talking about where this problem is prevalent are mainly rural setup. And they get this information better in their mother tongue. Finally, or second to last, the cost of this technology. Is it affordable for our people? And is there behavior or cultural or even religious change that we need our people to adapt? Because, you know, people resist change. Is there behavior, cultural, or even religious change that we need our people to adapt so that we work together with experts and scientists like you and local communities to control or eliminate malaria? Thank you.
Yeah, so at the inception of the project, we involved communication teams, which were very instrumental in digesting this work into simple communicable messages. And that worked really well for us to communicate to stakeholders. But then this issue of communicating beyond, the people that might have education came up during that time. And one Mzungu asked, who is able to do this in Swahili? When you're talking molecular, it becomes very difficult. When you're talking genetics, it becomes very difficult. In fact, when I went to give my PowerPoint in Zanzibar about the drones, I kept using the word drone. And someone asked in the meeting, hiyo drone anasema ni nini? Then someone just said, ndege nyuki, which some of you have learned right now, So getting to vernacular, I think it's a very important thing, but I think we're talking about a topic that is very difficult to digest. And if you get the correct words for it, that would be great. But some of those words, even locally within those languages, might not be understood. I'm just thinking loudly. But again, for me, that would be another take-home message from this meeting. Can we take this information to different local languages so that it can spread even further? Because the people in those communities are the ones which will have the mosquito in their backyard. So I think it's a very valid thought. And it's also very useful to talk to people, like if you get an expert coming to a studio to talk about something, I think that's extremely important. When I've done this work in Europe, not gene drive work, it's very common to get people from radio, from television. They also do research, I'm sure you do. And they just say, come and talk to us about ABCD. So that would be very useful, actually. It also makes me as the expert to read a lot because I know that this thing won't be communicated properly. So I try to digest. I talk to my grandmother and she asks me, what's that? I look for other words until she understands and then it becomes good. So that bit is there also. In terms of business interest, for this technology, I don't know. But when I look at what you can use the technology for, I'm sure it's going to be very big business. Maybe not for mosquito control, but for many other applications. I think anybody who doesn't listen to this technology for other applications beyond the mosquito work will lose in a business in a very big way. That looks like the next revolution from what I can see. And then you have another question about the cost of the technology, if it's affordable, and also if we need some kind of cultural, behavioral, religious change. This technology is very expensive. That's why in our local institutions, like the universities, molecular biology is something you can study, but you won't get the best out of it because it's very expensive. Even if you go to Cambridge, which is very well established, people are doing this work in Cambridge, but if you look carefully, there's a foreigner inside. There's a color of the dollar inside there that helps to run this kind of thing. So it's very expensive. And as my colleague mentioned, it's very useful if we can fund these things locally. I know we'll struggle with them, but we'll get to a point where it becomes a common thing, anyone can learn it. Cultural changes, I don't know. I mentioned about a community in India which takes a mosquito as a sacred organism. So if you kill a mosquito, you are in bad shape in that community. So there, you need a cultural change. If I can take back the question to the meeting, what are you thinking? What is that thing in your culture, in your religion, in your behavior that might be a problem for spreading this technology? Is there anything you can think about culturally, religiously, in the different parts of Kenya that can be a hindrance to this technology? Maybe if we think harder, there might be something, but I think immediately it's difficult to get a way out, an answer to that. Thank you.
Thank you so much. I would like to move us to wrapping up the session. I think we've had very good exchanges and conversations around emerging health technologies, and it's clear that we need to do much more in terms of working together as the researchers who do work in this area, but the media who then have the big opportunity to engage a wide range of the publics on these technologies, just to create awareness, but also provide a space where people can ask questions, get to understand some of these very complex technologies. I have a couple of takeaways that I just want to flag, but I know that we are hosting this as a FIDEP with the Editors Guild. So I don't know if you want to say something before I wrap up in terms of how you're seeing this partnership move forward.
Thank you very much, Rose, for this opportunity once again. And in summary, seeing and looking at lots of opportunities for collaboration between ourselves and you as an entity. My colleague there, my former VP, Mina, has already thrown it to you. You know, we have lots and lots and acres of airtime. Can you utilize that? That's one. The other thing I'm looking at is in terms of collaboration and training. We really are in need of intensive technical training and unique insights that may enhance our reporting skills in this field of malaria. The reason I'm saying we are really in need of that is already we are grappling with misinformation and disinformation. And these are presenting a very serious challenge to us as media in terms of accessing accurate information about public health crises such as malaria, and also about innovations that are there, you know, like the gene drive, as Mina has just thrown at you. It's anything technology-based, you know, even we saw it with the GMOs. It's always steeped in a lot of myths and superstitions and all that, you know. It causes cancer, it will bring infertility, barrenness, and all that. So how do we fight this misinformation and disinformation? It's by us working closely together. And with the new technologies that are coming, that are emerging in science and in malaria interventions and all that, for us as journalists, we also have to come up with new reporting techniques, ways of telling these stories. I was listening to Professor Mbogo. He had very many killer quotes that if I was running a WhatsApp group or maybe the Twitter page for KEG, I would be dropping them there, you know, where you are saying mosquitoes love sugar, they love smell, you know, things like those, that a female mosquito only mates once, you know, in their lifetime, and they keep the sperm or the egg in their bodies forever, you know. So those are things that can just ignite or provoke discussions. So you don't really need to think so hard about how do we sell you. You already have packaged yourself. You've made it so simple. This gene drive, the way you explained it to us, even a 5-year-old would understand. And this is the kind of approaches we would like to go into. Don't make science so complicated. Don't make malaria research and treatment such a, like, you know, very hard nut to crack. Break it down for us, and we will clearly tell those stories, and we have the opportunities. Again, we don't need to say it, but I would like to say that we really play a very crucial role in sustaining and informing discourse on any public health matter and any initiative that has come up. But again, we have to be responsible and be very impartial and informed when we are carrying out this information out to the public that need it. So as media, as we are sitting here as KEG, what we are crying out for is give us those opportunities to train our teams, to train our newsrooms. If there are times where we are looking for trusted information, editorial, like, you know, how do we tell the story from the perspective of a researcher, but still remain a journalist? If we came to you for help in ethical reporting and standards in health reporting, please don't say no, we are not available. So what you're asking for is please expose us as much as you can to expert speakers, give us access to those story ideas that are going to help us to come up with story pitches that we will really resonate and travel far. And if I can just bring it to an end, I would like to say, help the people sitting here, my colleagues, our newsrooms, our journalists, to deepen our knowledge of malaria and strengthen our journalistic standards. so that we can enhance, evidence-based reporting. We just don't want to report from he said, she said. Let's have the evidence, and also let's have best examples of how things are working. I know that if I talked, I would talk on and on and on, but let's drive this discourse. Asante sana. And thank you for the inviter.
I'm sure this one works. Thank you so much. You've paid it all, and our thinking aligns completely in terms of how we are seeing the partnership move forward with the Editors Guild. The point is really to ensure that this becomes a series of meetings on key technologies for Kenya, but also for the region, because Kenya is an important player in the region as well. And so we have started today talking about broadly health technologies, but zeroing in so much on malaria because we know what malaria means for this continent, but also zeroing in on some tools that could potentially be very transformative as far as malaria is concerned. Our focus is actually beyond malaria. So we are hoping that we'll have a series of other meetings that talk about other technologies as well, depending on the disease burden, and the research going on the continent, so that we keep opening these opportunities for media experts to link with the experts, the researchers doing this work, but also ask those critical questions. I think questions around IP are important. Questions around investments, what are our governments putting in? Because you can't be asking for a balanced voice and power in all these research partnerships when you are putting in nothing and your government is looking the other side whenever they're being challenged to invest in research. And these are some of the really important conversations the media can advance and further. And for me, I see an opportunity for us with the Editors Guild even having a roundtable around investments in science and what they mean for health. I think we didn't have government officials here deliberately because we really wanted to zero in on the technologies. But the next session really needs to have the government relevant officers in place to speak to some of these issues that have been raised here, issues to do with the challenges Professor Mkabana here has faced. Why is it so hard to get permits to try out some of these technologies like use of drones? So our expert here, trained here with local resources in Kenya, has to go to Zanzibar to do, that is a serious problem, right? And so it's not very complex getting these permits, but there's so much complexity in this country that things become very hard. And it's not just this issue alone. I think there are many other issues that get out of Kenya because of this leadership issue as far as science is concerned. So we are seeing a serious partnership in terms of focusing conversations around health technologies, but importantly, looking at some of those underlying issues to do with government priority, government investments, and how are those facilitating, or how do those need to shift for Africa to actually harness, the potential that these technologies have to offer, so that we start moving away from some of those huge disease burdens I was sharing earlier to levels that are comparable to people in the West, because some of these things shouldn't be killing people to that level. So thank you so much. This is a start. We see a lot of opportunity to engage again, and we'll be moving forward in terms of exploring collaborations with various media houses to take advantage of the acres and acres of time. Particularly linking with the researchers. So it's really not just AFIDE, but it's how do we provide a platform where the researchers and the journalists work more together, be they field sites, be they visits to laboratories, just to understand the science, and make it easy for the common mwananchi, to also understand these things and follow even as the technologies are being developed. So thank you so much. I can talk on and on, but really want to thank you for your time. And I'm seeing this as a first step in a long journey that we hope that it will really have an impact on the lives of Africans and the lives of Kenyans. Thank you.
If you can give us media, can give us
Yes, the things you say today, I did not. Thank you so much. And I can try the contact as well. Yeah. The focal point. Yeah.